I did hear somebody say good morning to Nikki. I apologize. I was trying to adjust my headset. So good morning to you as well.
Everyone will be starting in about 4 minutes.
Good morning, everyone. Welcome to the final day of the 2023 GODA Conference. My name is Liam Doyle, Senior Coordinator with the Governor's Office of Disability Affairs. I'm a white male with short brown hair and a full beard. Today, I happen to be wearing a gray shirt. Our first session of the day.
Liam, I'm so sorry. The interpreter says that she can't hear
Hear anything.
Okay.
So if you
Hold
could
on.
just give her a second.
And Dr. Kelly and Ashley, if you could turn on your cameras, please.
Hello, can you hear me?
Yes.
Oh, perfect. We're on.
And you can hear
Sorry
us
about that.
That's no
Yes,
problem at
a
all.
lot better.
Good,
Thank you.
perfect. All right, I'll go ahead and get started then. Good morning again, everyone. As I said earlier, this is the final day of our 2023 GODA Conference. My name is Liam Doyle. I'm the Senior Coordinator of the Governor's Office of Disability Affairs. I'm a white male with short brown hair, a full beard, and a gray shirt. Our first session for the day will be improving service options and access for individuals with IDD and mental health needs. The presenters will be Ashley McReynolds with the ARC of Louisiana and Dr. Brandy Kelly with the Office of Citizens with Developmental Disabilities. You can read the description for this session and their bios on page 20, 21, and 22 of the conference booklet, which will be linked in the chat below. And with that, Dr. Kelly and Ashley, I'll turn it over to you.
Thanks, Liam. Good morning, everybody. My name is Ashley McReynolds. I am a program director at the ARC of Louisiana. I am also the parent to a 17-year-old that has an intellectual disability and pretty significant co-occurring behavioral health conditions. I am a white female with shoulder-length brown hair, wearing a pink top, and I also have pinkish purple framed glasses. And now I'm going to turn it over to Dr. Brandy Kelly with the Office for Citizens with Developmental Disabilities.
Good morning. I'm glad to be with y'all this morning. I am Brandy Kelly. As both Liam and Ashley shared, I work for the Office for Citizens with Developmental Disabilities. I'm the clinical director for the office. I also have a sister who has an IDD disability and receives services, so I am a family member as well. I am a white female. I have chin length curly hair, brown hair. I'm wearing a white shirt and brown glasses, and I'm happy to be here to spend this time with you today.
Okay, just to get started, I just want to cover a couple of the objectives that we hope this training will help sort of better help you align and be able to identify what are the key systems in the state that you're going to either receive services from or need to receive services from, and the stakeholders that are involved throughout the state of Louisiana, both in the systems and then out in the community as well. We hope that you will, at the end of this, be able to identify 2 strategies for change. Could be within current services or the addition of new services that will help better meet the needs of individuals with intellectual developmental disabilities and co-occurring behavioral health conditions. We also hope that by the end of this, that you will be able to identify 2 additional strategies for better cross-systems collaboration, so that those key systems that we're going to talk about, how they can collaborate better, and some opportunities for some trainings.
Right, so I'm going to share some just background information of just a lot of things that have changed in many of the systems that individuals with disabilities and their families need to access. That kind of led to some of what Ashley and I are going to share with you today, and some of the work and the changes that hopefully we will take moving forward. So in the developmental disability system, over time, prior to the pandemic, we certainly saw a lot more people being served in home and community-based services. We closed a number of state-operated programs, and some of these programs included some specialized services, for example, for youth with legal involvement, and adults that had some sexually related challenges. We also downsized and privatized, or had private providers agree to run 3 other state programs that we had. And this included a stabilization unit that we had for people with IDD and mental health needs, but the private provider was not able to continue operating that part of the program. So that was another program that we lost in some of those years. And then we also lost some state employed clinical staff that were helping to address some behavioral health and psychiatric concerns. At the same time, in our Medicaid and behavioral health systems, there was a move to managed care. This was a little bit different for behavioral health services versus physical health services. So we, as a state, we implemented managed care for all Medicaid services, but individuals who received services through our DD waivers or who were on the DD services registry could opt in or out for those services. So they didn't have to be in managed care for their physical health or their early periodic screening and diagnosis and treatment services. Those are the services that youth have to be able to access through Medicaid, and the state has to provide. But if you received our DD home and community-based waiver, or you were on our registry, you could choose to stay in what they call fee-for-service or legacy Medicaid for those. But you could also opt to do it through a managed care entity. Behavioral health services were then moved into managed care. But the difference is that for behavioral health services, you cannot opt out of managed care. That's the only place that you can get them. There was also implementation of a coordinated system of care for youth that crossed various systems. And at the origination of this, when this started, youth who had our waivers in OCDD could not access some of those services. And then that has now recently changed in 2017. So you can see there have been continued changes. And there were also some closure and privatization of some of the behavioral health programs, including what people probably have heard of before as the DNP unit, or the developmental neuropsychiatric program, which was at the old Southeast Hospital and was a program for adolescents with IBD and behavioral health needs. So a lot of changes happened in the decade or so before the pandemic. And these sort of set the stage for both some positive changes, but also some unintended negative changes. And so the intent of these services was to have more privately operated services and a little bit less reliance on state operated services, and to have more people getting services in their home and community, and fewer people getting services in some sort of an institutional setting. And that stated goal, those two stated goals happened with these changes, right? So we do have more agencies that are not the state that are operating in programs and offering services. And we do have more people getting services in the community than we did before. The challenge is that we had some unintended consequences in this work. And some of that was because perhaps all the right people were not necessarily involved in and engaged with how we made those changes as a state. And so those consequences were not necessarily known. And so that led to the office working closely with the Arc of Louisiana and other stakeholders to make sure that we really stopped for a minute and took a look at what do we need to do differently, right? So we brought in a lot more stakeholders. So we worked with individuals and families who receive services. We worked with advocacy agencies. We worked with the districts and authorities, or what we call our local governing entities. On this slide here, it is what we're referring to when we say LGEs. We worked with provider agencies, people who were actually out there trying to help people meet their day-to-day needs. And we also worked with other state partners, right? So there were other service systems, not just the DD service system. And so we needed to be talking to our colleagues in the Office of Behavioral Health and Medicaid, our colleagues in the Department of Child and Family Services, the Department of Education, et cetera. So we really reached out to ask people what is working and what is not working. And so we did that through some collaborative work sessions and feedback sessions. And we looked at how does that help us to look forward to, better work together and collaboratively develop goals. And then how do we make sure that moving forward, we have ongoing stakeholder group and feedback sessions. So this really helped us to see, while some things maybe happened with the changes that were what people wanted to happen, there were also some things that we didn't anticipate that now were new problems and new issues that we were going to need to work through. Actually, I don't know, this is the slide you and I talked about. You may have some comments on too. So before I go to the next slide, I don't know if there's anything you want to add or share here.
Not particularly. I do just want to say that I wanted to make sure that from my experience with, having to work with the systems, trying to locate services, crisis type services, I found that the Office for Citizens with Developmental Disabilities, or OCDD, had a better understanding of how all of the systems worked and how families could go about navigating them. Where I struggled was with the Office of Behavioral Health, not quite understanding or not being as familiar with the OCDD system. And the breakdown then became even further with the involvement of the managed care organization. And as a family member that lived in crisis for a long time, I felt it super important that I get as many families in similar situations as myself to come to the table, be willing to share, because their personal experience, their lived experience, to me, was the most important piece that could drive the change that was needed to help better serve their loved ones and just better improve their entire family unit as a whole.
So to kind of add to what Ashley just shared from a family experience, one of the things we did as an office in working with Ashley and other families and looking at sort of what was working and what wasn't, is we looked at many of the things we had tried to do through our office, in particular, utilizing our resource center staff, which some of you may know and some of you may not, or some clinical staff. So we have psychologists, social workers, speech therapists, physical therapists, occupational therapists, who worked for us previously in some of our programs that we were able to keep, that we have now built into a statewide resource center. And a lot of times, folks ask for our resource center staff to get involved, and there's a lot of reliance on us. And what we were discovering was that while the resource center does do a lot of good work and have a lot of good outcomes, we can only directly touch and interact with so many people. And so what we wanted to do was figure out, how do we take the good work we have but actually extend the outcomes, because despite some of this good work, what was apparent was we needed to be engaging more with all of these other systems while also working with families, because the OCDD service system just doesn't have all of the services that are going to meet everyone's needs. And so these are just some things that we continue to do most of this in the Resource Center, but you'll see as we go through the presentation how we're using this to sort of build on our own systems, but also how we can interface with other systems and work better to get better outcomes. So we have what we call an urgent triage and diversion process. And this is where if someone is living at home in the community and they may be at risk of losing their current living situation, we have a partnership between the district and authority and our Resource Center staff to engage and outreach to that individual and their family and any support system they have if they're receiving services, to look at what could we do to help them be able to sort of stabilize their current situation and continue to live, work, and receive services if they are in their home and community. And what we know is when we're able to do that early, when our Resource Center staff is able to partner with the local office, 90% of the time we can divert any movement to a more institutional setting or a more sort of intrusive set of services for that person. And we also know that 99% of the people we get referred through this process have co-occurring behavioral health needs. So this is not something that is happening frequently for individuals who have a disability condition and they don't also have co-occurring behavioral health needs. We also have a partnership with the districts and authorities to look at individuals who have had a history of some non-consensual sexual behavior. We know that there are times that folks may struggle. They may or may not understand some of the actions. They may also have a history of some trauma. And we want to be sure that these are individuals who are getting the supports, education, and supervision they need so that they can continue to also live in the community and not have a recurrence of those types of behaviors, which put them and others in the community at risk. We currently follow through this process over 200 individuals statewide. 100% of those people that we follow have been able to maintain their ability to live and work in the community. And we have a very, very low recurrence rate. And usually it is not a recurrence that actually has direct contact with another person. So this has been a really effective process. So we know through these first two processes that when we can partner early with the local district and authority and bring in additional resources, we can effectively support people even when they have co-occurring behavioral health issues or behavioral concerns that might place them or others at risk. The Resource Center also does direct treatment in instances where there are no other services, or we will consult to a clinician who maybe hasn't had a lot of experience providing behavioral health or medical treatment to an individual with a disability, so they can modify treatment and be effective in terms of having positive outcomes. 95% of the folks we engage with are able to continue to live and work and receive services in the community. And we also have a 98% satisfaction rate. So again, we know that effective treatment can be provided and can be successful. We've also done some technical assistance projects with providers and with clinical agencies. So the DDC is, of course, the DD Council, and the TTI is a SAMHSA Transformational Initiative grant. And in the work that we did with these providers, we were able to decrease emergency room visits, hospital stays, critical incidents. And we also saw positive outcomes in terms of increased connection and relationships and steps towards community employment. And then we do professional training and continuing education to clinicians, and we also get a pretty high satisfaction rating on our evaluations and a lot of requests for more. So I share this not just to say our Resource Center staff are doing great work, although they do, but to tell all of you that even with these good outcomes, the challenges that Ashley shared as a family member were still happening. And so when we looked at what was working in the system and what wasn't. And we also looked at, even with the positive outcomes we were getting from our work, we couldn't meet all of the needs. So we really felt like we needed to do some things differently. I think Ashley's going to share what the families felt needed to be the first step and got us moving in the right direction in a moment. But we wanted to look at, okay, so how do we expand this? How do we go beyond just what our set of clinicians can help people with behavioral health and disability conditions do in terms of positive outcomes? How do we spread this? How do we get better outcomes for more people and make sure that the family experience isn't the way that Ashley described, and that everyone doesn't have to wait until they can get to one of our clinicians to actually get the services that they need? So I'm going to turn it over to Ashley to talk about what the families sort of pulled together and working with the ARC and other agencies to begin to sort of spearhead how we could move forward.
So a couple of years ago, I personally experienced some pretty significant crisis situations and was unable to access any type of community-based type services. We were landing ourselves in the emergency room, unable to find any type of assistance through private residential treatment facilities or PRTFs. Hospitals were not wanting to accept my son due to their inability to accommodate, was the reasons that we were getting. And we were just left sort of turn after turn being denied assistance and help when we really needed it the most. So unfortunately, I was not the only family member. As I reached out to family members, to friends who were also sort of trying to navigate these systems, I was hearing the same story like mine over and over and over again. So we began talking about what can we do to try to, again, pull a group of people together to really take a dive into both systems, to all of the systems that, unless they work together, our loved ones are not going to get the care, the support, and the services that they need to be successful, to remain living in the community, all of the things that we all want for our loved ones. To be honest, when I first looked at this, the first thing that came to mind was we need to bring back the developmental neuropsychiatric unit, the stabilization unit. Those were the two main services that were once available that I really fought for and that I thought were needed to bring back. Families are experiencing issues in accessing providers. Most don't accept Medicaid. If they do, the wait lists are extremely long. Access to applied behavioral analysis, or ABA, is very difficult. There are wait lists. The older your child gets, the less clinics that are available to serve them, because most do not serve an older population. So the services that are available were very limited. And it just became difficult, and families just continually expressed that they were unable to locate the needed services for their loved one. So this is why, I brought together this group of people. We started talking about, let's put together a formal work group. And that was sort of how this stakeholder group came about. And we wrote, which is now HCR 33, and really put together, I think, a really great HCR with some very specific goals that we'll talk about in the next couple of slides. Next slide, Brandy. So the saying is true: if you build it, they will come. But as I worked through HCR 38 and we had, just larger discussions with the right stakeholders at the table, it was very clear that a place or a particular unit really wasn't the solution after all. There are community-based services. We have a need for significant changes and additions to crisis services that we hope we can further build upon, that will shift the need away from a place for these individuals to go and receive specialized type services. I realize that if we do build these fragmented or segmented places or units within the system, that at the end of the day, we're just going to further fragment the system that provides the services that our individuals and loved one needs. So we really tried to shape the focus around the larger community style services, looking at ways that we can work together to provide educational and training opportunities for current providers to be able to feel more comfortable, be better equipped to serve individuals that have any type of intellectual or developmental disability, to build the number of providers across our state that are, again, comfortable and willing to serve this unique population. So as I said, while the conversation started with the need for a specialized place for individuals to go and receive services, it very much then shifted. And it was due to family experiences, to the feedback of individuals themselves who are experiencing these difficulties, that really began to shape the discussion, which led to really just a better outcome and a game plan across all of the systems that truly have to work together to serve this population. Brady, I don't know if there's anything you'd like to add. Okay.
Sorry,
So-
I muted myself, Ashley, and then didn't unmute myself. I think.
Oh, gotcha.
I think you covered all that very well. So I'm good to go to the next slide.
Okay. So HCR 38 was written in the 2022 legislative session. And within that HCR, we spelled out very specific recommendations, things that had to be studied across all of the key systems that provide services to this population. So we needed to have everybody look at everything and then come back to the department and provide very specific recommendations on certain categories. So some of those categories were increasing access to existing community-based services, some type of interface with a new crisis system, and that there was access to those services when families or individuals needed them. So it took us looking at what does our systems currently offer versus what are families truly looking for in terms when they encounter like a crisis situation. So we looked at all of that. We have to engage our managed care organizations because, like Brandy noted earlier in this presentation, managed care is now the way that we all receive our behavioral health services. And I, as a family member too, have encountered many issues when trying to reach out to my managed care organization when looking for behavioral health services. And when I would let them know that my son also received services through OCDD, a lot of times I was just sort of transferred back to OCDD because all they saw and all they heard was that he had a developmental disability. And so this was a part, and he needed to go and be served by OCDD. Well, what I really needed was some comprehensive behavioral health services. So I thought it was super critical that we engage the MCOs in this HCR process. They were a part of our conversations. They heard from myself, from individuals and other family members about some of the barriers that they were facing when they were reaching out to their managed care organizations and what families truly needed when we did make that call. We also discussed and talked about the need to really implement some specialized education and training when looking at future doctors. This, unfortunately, what I've learned over the past couple of years is that for a long time, I felt like my son needed a behavioral health professional that was specialized in treating individuals also that have like an intellectual development disability. And sometimes that can be true. But what I also learned is that there are hundreds and hundreds of fairly simple accommodations and modifications that psychologists, psychiatrists, social workers can make to, you know, the assessments, to how they provide, you know, like their services in office. They can make their current behavioral health services accessible to people that have intellectual and developmental disabilities. So while there's still a significant need for training, there's also a significant need for just an increase in these types of clinicians. There's a significant shortage in Louisiana. This is also a nationwide issue. So Louisiana is not any different than most other states in having a lack of access to providers. But we also need to train current providers and those coming up through the system in their residency or early years of practice about certain accommodations and simple sort of modifications that can be made to better serve individuals that have intellectual and developmental disabilities. Also, the need and the recognizing that there are just certain situations where individuals need some type of, you know, placement or treatment to have access to residential options when they're needed. And what we have found that there are very few of those PRTFs that are truly equipped to accommodate individuals with intellectual and developmental disabilities. Brandy noted in a couple of slides back that there was a grant a few years ago with the Developmental Disabilities Council that really led to some great partnerships with some of these providers. And it has made a difference in the types of treatment and services that these individuals has received at these particular facilities has led to, you know, their name just getting out and individuals looking to go to those specific providers. So just the need for that continuing education within the providers is also still important and still needed. So we got a group of, there was about, I think, 20 or 22 of us total. It was spearheaded by parents and advocacy groups. We did lead sort of the conversations. We got a ton of support. We didn't have any opposition on this particular piece of legislation. It was supported across party lines. It was co-sponsored across party lines, which was great. And it really forced some difficult but needed discussions across these key systems that we look to in times of crisis, and then just in our everyday look to get the needed supports and services that, you know, our children, our adult children need to be successful. So here's an overview of the stakeholders that were specifically spelled out in the HCR, which I also think is important to note that I went through and named not just the systems or the organizations, but who specifically from those organizations needed to be at the table. So you'll see here, we have OCDD, the Office of Behavioral Health, our managed care organizations, our coordinated system of care or CSOC, a lot of parents. We had providers of developmental disability services. We had behavioral health providers that included one private residential treatment facility provider. We had clinicians across the board, some that have moved into the private field, but were part of the resource center. So I really tried to ensure that I included all of the key players in the systems, and then brought together a range of individuals with disabilities that also had co-occurring behavioral health conditions, and then parents across a wide range of ages to ensure that we had those that were, younger, or middle-aged youth, and then up to adults, to try and get the best possible outcome. And we all put together, a lot of work. We came up with some really great recommendations that all of us supported, which I also think was super important. So when the department received the report with those recommendations in them, that every single person a part of this group agreed that these were what was needed, and sort of spelled out to the department, these are some ways that we think we can start to initiate to these conversations to get these needed services that we either need to expand upon within the systems that we currently have, or look at bringing new services on board that we haven't had in the past.
All right. So we are going to spend some time on the next few slides actually sharing with you a little bit more detail about the recommendations. And once I share that with you, Ashley and I will kind of each take turns sharing with you where we are already seeing some progress related to these recommendations. I want to add, just to echo the importance of bringing together all of the people that were brought together and the agreement that Ashley mentioned. So I led the group and wrote the report, which then had to go to the department leadership to review. And while we had some minor edits that they requested, I think because the right group of people were brought together, and because we were able to think through these recommendations in a way that was really designed to maximize access to what already existed and to really think through how we could look at anything new, we had total support from department leadership that they felt confident that we could move forward with these recommendations. There was no concerns or questions about any of the recommendations, and all of the recommendations stand in the final report exactly the way that the group made them. I want to highlight that you heard Ashley share that sort of in that desperation that she felt as a family member, and in talking with many other family members who were at that same place, they really were at the beginning thinking that there are times when our children are experiencing some intensive behavioral health needs, and they need a place to receive treatment. And sometimes that treatment can't happen in the home. It just doesn't feel safe. And so there was a big focus on the sort of residential piece and the sort of a specialized unit. And I just want to call your attention to the fact that the vast majority of the recommendations that we made, you will see, were actually in accessing the services that were in the community. So we, as a group, made 15 recommendations related to accessing community-based services and or expanding them. We have 6 recommendations to work better with our managed care partners, 4 recommendations related to crisis service access. So all of those are actually in the community arena, right? And then we had a small number of recommendations. So we have 4 recommendations we'll cover that were related to how do we make sure people can access psychiatric residential treatment facilities when they need them. And then we had some recommendations related to considering specialty units, but you'll notice we had more guidance that was put out by the group that if we were going to pursue as a state any form of specialized treatment, how do we do that in a way that actually makes sure that we don't assume that simply because someone has a disability, they have to access a specialized service, because people should be able to access the same services that any of us could access. And that we also make sure that we don't create sort of separate fragmented systems that might be more costly and less sustainable over time. And then we had some additional recommendations that sort of fell in the other category. And most of those had to do with community-based services too. So I'm going to share these various recommendations with you. We'll go through each of the groupings. So in terms of increasing community access, one of the things that I think was really interesting in the group was when you actually look at the type of services that are available that Louisiana will pay for and that the managed care entities can authorize, we actually have a pretty good array of services for behavioral health needs. That doesn't negate some of the things that Ashley shared, but what we figured out was the problem isn't that we don't have services. The problem was other things. So one of them was education. So I know, Ashley, you said this in the group. I think a couple of our other families, I didn't know we had all this in the behavioral health system. So I think one of the things that we discovered was that when a family member is trying to access services for someone with a disability, you get really familiar early on with the OCDD service system, and also probably what you can access and expect from your school related to your child's disability needs. But there's not necessarily the same awareness and education as it relates to what can you access for your child's behavioral health needs. We also, though, got some feedback from some of our partners, particularly our partners in the coordinated system of care, that they were also seeing the opposite happen, that family members who had young children who early on really had some very clear behavioral health needs, but might have some disability needs as well. When the behavioral health need was really at the forefront, they often knew more about how to access behavioral health services, but people were missing that the child might also have some disability needs. And while all this work wasn't limited to children, one of the reasons this focus was on talking about families and young children is because we all know that the longer we have to wait to get people access to what they need, whether it is for their disability needs or whether it is for their behavioral health condition, we lose valuable time that can affect the outcomes that person has in their life. We also, so we really wanted to focus on education across systems. And that was for parents, but it is also, and you'll see a repeat of some of this when we talk about how we can better partner with our managed care partners, is also making sure each system understands the other systems and that we all know what everyone else does and does not do, and how do we work together? How do we access and help others access it? There were recommendations about how our districts and authorities can be used to help in this effort, because the districts and authorities have a behavioral health division and a developmental disabilities division. So there are some recommendations about how the department can work with our local districts and authorities to look at how they can do some creative things to serve individuals who may have needs across DD and behavioral health, because they have the ability to work sort of across their offices and divisions. And they also provide some behavioral health services. So when people have trouble accessing those things, that could potentially be a resource. We made some recommendations in conjunction with the managed care partners who were a part of this, that they would look at possible billing and coding options. And most of us don't want to have to worry about how somebody bills and codes, and we shouldn't, but we all know that if somebody can't get paid to provide a service, it becomes an access issue. And we do know is that some of the modifications that Ashley mentioned sometimes then mean that maybe treatment's going to take a little longer, or a session might last longer, or it might have to be different. So the managed care entities worked really well with us, and they are going to be looking at, are there some ways they can make sure that when someone needs a therapy or treatment of some sort, that the clinicians who need to provide this are able to actually bill and authorize for what is needed, and that we can make sure that that is not a barrier. We had recommendations related to improving collaboration across entities. As a family, it can be very exhausting to have to continually repeat your story, right? To have to tell the story over and over from the beginning. Sometimes it's frustrating. We have services that are all within the department, but maybe they're overseen by different offices, and yet it's not neat and efficient how we talk to one another. So how do we have all of the coordinators in all these different systems know about one another, know how to talk to one another, and plan together, so that planning isn't happening repetitively or in different sort of fragmented ways. There is a new community health worker option that the department is supposed to be looking at implementing. And so one of our recommendations was also assuring that this option was accessible to individuals with disabilities and their families, and that as this option is implemented and rolled out across the state, that families are included, so we can make sure that it is available and accessible, and that they know also the disability services and how to help people navigate getting what they need. We made recommendations as a group for stronger partnerships with universities and licensing boards, so that we can begin to have dialogue about how do we make sure that every clinician training program includes information on understanding the needs of people with disabilities, and how to make sure that whatever practice you are going to school to learn as a clinician, that you know how to make sure that people with disabilities can come to your clinic, your practice, et cetera, and that you can feel comfortable providing services and knowing how you might need to modify your office, the way that you do sessions, et cetera. And the reason we have the licensing boards there is because we also want to be sure that we are getting to clinicians that are already providing services, right? And getting continuing education out to them. And our stakeholders in Louisiana have had real success in getting some requirements for dental education out there. And so we want to do some similar things with other disciplines in the behavioral health arena, so that people need to get continuing education to be able to really better serve individuals with disabilities. There are recommendations that are encouraging the department to assure continued funding and resourcing of their OCDD Resource Center, because that is where we have our largest hub of expertise. And the Resource Center is able to sort of collaborate and consult on many of these activities and recommendations. So that is something that we wanted to make sure we did not lose. The ARC of Louisiana had also, kind of around the same time, and Ashley's going to talk a little bit more about this, had just begun a grant related to meeting the needs of individuals with IBD and mental health concerns. And so the group also wanted to continue the work of that grant, and actually agreed to expand to include the entire work group. There are recommendations on needed collaboration between managed care entities and private insurers, because some of the individuals who receive services through our disability system continue to have private insurance in addition to Medicaid. And we noticed that their families were able to share, there were sometimes some drop-offs between those things, those funding mechanisms. We have some recommendations on looking at how we can incentivize the assertive community treatment teams to be more able to engage with and serve individuals with disabilities, because we do know that these teams will come to meet people where they are in the home and the community when they need services. And that can be of great benefit to individuals and their families. But not all of these teams have experience in providing that type of service. And it also, some of the research that we were able to look at shows that sometimes you need some additional resources because of co-occurring medical needs that individuals with disabilities might have, and some of the ADA background that Ashley mentioned. So incentivizing them so that if they need some additional consultants or resources, that they might better be able to do that. We also discovered that we have some additional therapies in our children's choice waiver and a complex care add-on option in our new opportunities waiver in the OCDD system, and no one's accessing it. So we got a lot of feedback about either there weren't providers of those services, or people felt like the process was either difficult or people didn't understand it. So there were recommendations for our office to look at what are the challenges. Why are we not getting providers to enroll for some of the therapies in the children's choice waiver? And what are the challenges in the complex care add-on request process for the new opportunities waiver? And then we made some recommendations for some additional services to consider in our waiver, likely starting with the new opportunities waiver since it is a comprehensive waiver. But we are going to be looking at crisis therapeutic respite and an enhanced behavioral support shared living option. I'll talk a little bit more about that in a later slide. In terms of recommendations for managed care engagement, as I mentioned, you will see the repetition of the education across agencies and making sure that managed care entities know what is and is not in the OCDD system, that we know what is and is not accessible in the managed care arena. We have a recommendation for a more formal partnership between the managed care entities and our OCD Resource Center clinicians so that we can be a resource to them and work together a little bit more early on when an individual might be having difficulty accessing services. The managed care entities agreed to do a survey of their clinical providers to see, well, who does feel like they have an ability and a willingness to provide treatment so that we know sort of where do we stand today. They know clinicians and agencies they can refer people to now, and we know where to target education to increase those numbers. Again, you have the repeat of the cross systems education for individuals and families so that they understand how to access services. There's a recommendation for doing some joint quality monitoring related specifically to meeting the needs of individuals with IDD and behavioral health, and are they able to access services, and sort of looking at are we getting access across the spectrum of service options. And then a consistent process for how do we engage for clinical consultation and planning across systems. So those were the MCO engagement related recommendations. The crisis system for adults was just rolled out. As we started this discussion, there is now beginnings of crisis services for children. So we may repeat some of this as well. There is a service, crisis stabilization and crisis intervention, that is available for youth. And one of the things that came out was similar to what I shared with our some of our services and our waiver options. There's not a lot of providers, so there's not access. So one of the things that was agreed is that the managed care entities and Medicaid and the Office of Behavioral Health would look at what's impacting the enrollment of these providers, and what do we need to do so that if we say we have these services, they really are available. There was a recommendation to work to clarify how the new 988 call centers and the managed care crisis call centers kind of work together, so that people understood those two options. There were also recommendations to the department to just assure that in any future changes in the behavioral health system, that the Office for Citizens with Developmental Disabilities and our stakeholders are involved in planning so that we can be sure that anything that needs to be considered so that individuals with disabilities can access those services, that we're getting that done early in the process. We made recommendations for required training for the existing crisis providers so that they could understand what behavioral health presentations might look like in individuals with disabilities, understand the services they should be able to access in the behavioral health system, and also understand the OCDD system so that if somebody needed to be connected to something related to their disability needs, that happened as well. We also had started some work and discussion with the Center for Start Services, which is a national organization based out of the University of New Hampshire. It is the only evidence-informed treatment model for individuals with IDD and behavioral health that is specialized for that, right? So as Ashley mentioned, there is a lot of research about modifying existing behavioral health treatment, but this is a service that looks at individuals with pretty complex IDD and behavioral health needs, often ending up in crisis. And this is a treatment model that is very effective at reducing ER visits, hospital stays, et cetera, and improving positive outcomes for people to be able to receive services and live in their home and community. And we had begun discussion with them to do a systems analysis where they can look at even more formally than we already have, where are we spending our money in Louisiana and what's working and what's not, and how might we utilize the model that they have to enhance services and to sort of bridge the DD and the behavioral health system to work better together. So there was a recommendation to proceed with that, and then to look at, as I mentioned, funding crisis therapeutic respite in our OCDD system.
Hey, Brandy.
As it relates to, go ahead, Ashley.
Hey, we have a couple of questions. I don't know if we want to try and answer a couple of them or just wait till the end.
Let's I'm thinking let's get through our slides just
Okay.
because I'm worried that, yeah.
Okay.
All right. So as it relates to accessing psychiatric residential treatment facilities and or any specialty unit considerations that we might move forward with, the recommendations were sort of consistent. The first was we want to collaborate across all levels of care and make sure that the full continuum of services are available to people, and that when people have to go from one level of care to another, that there is collaboration and planning. We crosswalked the PRTF services with the old developmental neuropsychiatric program and looked at what would we need to modify or what kind of things do we need to think about that might either help existing PRTFs better serve individuals with IDD, and if we were going to do a specialty unit at any point, what might that look like? We made recommendations to partner with existing PRTFs and treatment programs, and that refers to the grant that Ashley mentioned, kind of expanding what we were able to do to other PRTFs and programs. Exploring grant funding for startup for any specialty programs, and then partnering with the Department of Education so that we can make sure that youth and adolescents who might access some of these programs continue to receive the educational services they need while they're there. And then the other recommendations that the committee made was enhanced collaboration between the Department of Health, the Department of Education, the Department of Child and Family Services, and the Office of Juvenile Justice, so that all of the child serving agencies can work better together to help families assure that the needs of their loved ones are met. Communicating clear points of contact across systems for individuals and families so that people know where to go, right? Who you contact and for what. Oops, sorry, I got ahead of myself there. Making that sure that when we are looking at health equity considerations in any of our programs, that this would include looking at people with IDD and that their ability to access needed services. That we incentivize existing clinicians and providers because they may have to do some extra work and training initially. And then assuring access to needed inpatient services for those in ICFs, because we did discover that individuals who, especially adults in intermediate care facilities, are not in managed care because in general, for their day-to-day services, the intermediate care facility provides that via clinicians who are contracted. But what we know is that if somebody needs to go to the hospital, right, the intermediate care facility doesn't provide that. And so there was a barrier because Legacy Medicaid can only pay for certain types of inpatient stays. So it limits their access, and that has become a challenge. And it means that if they end up at a psychiatric unit that is in a freestanding hospital, then it isn't covered, and the intermediate care facility would actually be on the hook for paying for that, which would be quite expensive. So we certainly want to be sure that when someone needs that, they are able to access it. So we're working with the ICFs now to make sure they know this, that the hospitals know this, and that they are getting access to inpatient care where it can be paid today, and that they, as a state, we are looking at what needs to maybe be different in the future. So those are the comprehensive recommendations from the group. Ashley and I are going to talk a little bit about which of these we've been able to move forward before we sort of wrap up with you guys. So Ashley.
So the ARC of Louisiana has had a small grant through the Southwest ADA Center over in Texas. And in this last 5-year cycle, we made some changes to the healthcare disparities piece and wrote in some specific language that allowed us to really focus and expand our work on individuals with co-occurring disabilities, so individuals with IDD and co-occurring behavioral health conditions. So the first step to that was sort of putting a group, again, of stakeholders together across families and individuals to our, key systems within the Department of Health, including CSOC. And we sort of just dove into sort of what were our main barriers. And one of the first items that came up was a lack of providers, community-based, if it's, a need of residential type treatment, the lack there. And the first thing we decided on doing was developing a guide for providers that could walk through some of those modifications and accommodations that they can make to their practice to make their services accessible to individuals with intellectual and developmental disabilities. What I've learned is the majority of individuals that have an intellectual or developmental disability have a mild developmental disability that the most simple and minor accommodations and modifications that can be made can make those services accessible. So we wanted to put out information to providers of the best practice of how to do that and some specific examples that they could use to then go and implement those and make the changes, to their practices. So that was the first thing that we really worked on. We got that provider guide completed. There is a link in this PowerPoint to that guide. Then we moved into the HCR. And then from the HCR group, our original group had wanted to complete an individual and family guide to help them walk through the systems to hopefully make accessing services so much easier, whether you're in a crisis or not. So we've been working over the last, I want to say about 7 months on that guide. And I'm super happy to say that as of yesterday, it is completed, and I will put a link to that guide in the chat for everybody to access. We are super hopeful that people find it as great as we think it is. And it's something that I wish I had 5-6 years ago when we really started trying to navigate across systems and just were met with barrier after barrier after barrier. So again, this was developed by families, by individuals with disabilities, these key players within the systems, clinicians, community-based clinicians, providers of these services, CSOC. It really was very much a group effort to get this done. So we're super excited and hope that you will find this guide as resourceful and helpful as we think it is. So we do anticipate this work group continuing to meet and work together as things arise, as changes are needed within both the provider guide and the individual and family guide. We will get together to make those changes and hope that we can, just continue the good work that we started a few years ago.
So kind of continuing as an extension of some of what Ashley shared related to the clinician guide, we obviously continue to do training and education through our OCD Resource Center clinicians. We're also doing some partnering with the National DD Directors Association and the National Association on Dual Diagnosis, as well as some colleagues in other states, to really look at how do we keep education for clinicians going and how do we do it more effectively. And so the guide Ashley mentioned is really specific to some things in Louisiana and some easy tips and modifications all in one place. We will continue to do training and put out other resources for clinicians as well. And so we are also changing the way we do that a little bit. So we're trying to make sure that we send the message that we're actually not asking clinicians to do something new. They do the work they already do, but they're just some basic modifications where that same work they do can benefit an individual with a disability, just like it would benefit someone who does not have a disability. And we have some white papers and tips for clinicians. They are on the ARC of Louisiana website on their healthcare page. They are also on the National DD Directors Mental Health Resources page. And they take the common behavioral health treatment approaches one at a time and talk through in a few pages the research that shows that these modifications don't change the practice and they are effective so that individuals with disabilities and behavioral health conditions can have positive outcomes. We also are engaging with some university partners and beginning to look at how do we expand our reach in terms of clinical treatment. So we are just starting a partnership with Ochsner-Shreveport where we are doing training with their psychiatric residents as well as their psychology interns. And we are going to utilize that experience to then do outreach to some other training programs so that we can begin to reach some clinicians in the time of their where they're getting training. And then we're looking at taking some of our trainings and actually doing short videos so that little nuggets of information, even when people don't have a lot of time or they don't want to feel overwhelmed by sort of an hour or a 2-hour educational workshop, that they can go and look at some of this information and feel a little bit more comfortable providing treatment. We are going to then work with Ashley and Kelly and others at the ARC to do some informational sessions for individuals and families so that they also can continue to get what they need to interface with clinicians more effectively. We've already started training with our partners in the coordinated system of care, and we are working collaboratively with all 6 managed care entities related to training for clinicians and providers in their network, as well as doing some training with their care coordinators related to our DD service system. So we've already begun all of those activities. We started some formal liaisons and partnerships. So I mentioned already the coordinated system of care. We're doing joint trainings with them. We also do some joint planning and discussions related to how we might meet an individual recipient's needs. We now have a formal liaison assigned and established with each managed care entity so that they can get to one of our lead clinicians quickly, and our lead clinicians know their lead clinician as well as their IDD liaison. They each have one so that we can work collaboratively together. We also have formal liaisons with the 2 state-operated psychiatric facilities so that when we do believe that someone needs inpatient treatment, beyond what you may get in a short-term hospital stay. We are able to work across our systems to make sure that people get that treatment, but that there's also appropriate planning when they are ready to discharge. And we already started training with the crisis providers. So we worked with the Center for Evidence-Based Practices at the LSU Human Services, Human Development Center, and we built a training for crisis providers. We've already delivered a training jointly with them to those providers, and we will continue that partnership as well. We are looking at the issues related to accessing therapies in the Children's Choice Waiver, as well as the complex care in the now. We've pulled all of the requests that have been made so we can look at what the outcome has been, what the problems might be. We've already begun drafting with we actually used the ARC group since that group was already together. We've already looked at some initial service definitions and provider requirements to begin building into our new opportunities waiver, enhanced behavioral support, shared living service, and a crisis respite service. The START systems analysis has started, and they actually just this morning sent out the email. I got it. Ashley's nodding her head to begin a family survey. So they'll be doing family surveys, and they'll also be doing some focus groups. OBH has gotten some grant funding and has worked collaboratively with our office. They are drafting a request for proposals for a PRTF that would specialize in being able to meet the needs of individuals who also have IDD. So it wouldn't be that the PRTF service itself is different, but that there would be consideration of the additional needs related to someone's disability condition and making sure that they can access that. And we are also looking at opportunities to expand collaboration with existing providers. And then within our office, we are also trying to now move to a little bit more of a proactive approach where we really are looking at wellness. So not just treatment on the back end. And we're looking at positive psychology practices that we can actually infuse into our system. And what we know is that the research says when we can pair promoting well-being with treatment using traditional behavioral health practices, that's when real change happens and it is more sustained. So we have now taken some of the partnerships that I mentioned early on that we had between the local district and authority and our resource centers, and we are formalizing them into some waiver practices so that we are catching situations where someone might be having the early risk indicators, right? Repeat incidents of certain types, where we are then utilizing the partnership between our resource center and the local staff to see what is missing in the support structure for that person so that the person doesn't have to continue to have those types of incidents. So it will include the urgent triage and diversion that I mentioned, as well as the local oversight team, but we are expanding it to some other risk situations. We also have developed a DSP wellness training that we are about to roll out so that we are shifting the focus of supports to promoting wellness and moving a little bit away from the more traditional positive behavior support or PBS focus, not because it is not something that is good, but we really actually want to do something sooner than that. We want to make sure that folks understand we need to support wellness, even if someone isn't having behavioral health issues or behavioral challenges, because that's how we often prevent those. And we just finished an individual and family wellness toolkit, which Ashley does not know yet, but I'm about to send to her, that we also want to look at how do we get those tools out to individuals and families so you don't have to wait until you're getting a service or having a provider. Anyone that is, can use it. You can use it at school. You can use it with family members who may be providing support, et cetera, so that we promote wellness at baseline.
And Dr. Kelly, I'm gonna go ahead and jump in. I'm sorry, we're almost out of time, but we do have 2 additional questions I want to make sure get answered very quickly. Sandra asks, saying the great resources with CHWs, would that be offered through the members waiver through their waiver case workers or through their MCO?
So the community health worker would be accessed the same way it would for anybody who did not have a disability. So it wouldn't be different. What we have not had yet, Sandra, is any in-depth conversations in the department so that, you know, how a care manager on our side kind of connects somebody in. Yeah, I don't know all those nuts and bolts, but the access point would not be any different.
And lastly, Pamela asks if who is the contact person for Oshner LSU HSC initiative in Shreveport on the OLSU side?
I would have to get that name. So Dr. Bounds, who is our associate clinical director, is actually our contact.
Okay.
And he's working with them. I can certainly try to get that information to Dr. McPherson if she wants that, but I don't have that name readily available to share.
Well, that's fine. We'll make sure that we'll follow up and get that information out. So I want to thank you both again for being here, and thank you for your time. This has been a really great session. Our next session will begin at 10:30, and you are welcome to stay on live. The next scheduled session is how Social Security disability benefits planning can support successful transition to work. It's a very long title, but obviously a very important topic. So like I said, we're going to begin in just about 15 minutes, and thank you again both for your time, and stay on live with us.
Thanks, Brandy and Ashley. Great presentation.
Thank y'all.
Hi, Liz. I can see you.
You can't hear me.
I mean, I can hear you. Yeah, I can hear you. And I moved Donald, let's see, Donald Leger and Rose Angelucci. Okay. So if you want to just test. Hey, Ray, how are you?
Good morning.
Good morning. I can see and hear you.
How's my audio?
It sounds great. Yeah, both sound great, look great.
Okay.
Ray, you don't look as good as Liz. I mean, she's out on the
Oh,
beach.
no.
She's out on the beach, so it really looks good on her.
Yeah. She's,
Rose,
yeah.
Rose, if you want to unmute yourself and turn your camera, we'll test that out.
Okay, y'all see me, hear me?
Yes, ma'am.
Okay.
Oh, good looking group. Do y'all have a PowerPoint you're going to share or a presentation you're going to share, right?
Yes.
Yes, I'm pulling it up now.
You want to, yeah, just practice pulling it up, and then you can pull it back down.
Okay.
Was a button. Speech on demand. Currently unmuted.
Okay.
And just so y'all know the way it's gonna work, we'll, let's practice. Let Don practice his slide first.
Okay. Can you see this?
Yeah, you need to go to, yeah, from beginning. Don should do it. I should have said Ray. You confused me with your names.
It's okay. It's okay. You can call me whatever you want. It doesn't matter.
Okay, looks good.
Okay.
So if you're okay with it, you can go ahead and take it down. And what they're gonna do is Alicia is going to introduce you guys. Keep your camera on
Okay.
there, Alicia. And then the interpreter will be on at that time and she will be spotlighted. So the people who are watching will see all of you guys and the interpreter, the ones who are watching live, but the recording will only capture the interpreter since she's spotlighted, which is what we want. So we want to capture your beautiful and handsome faces at the beginning, because once you share the slide, it'll only be the interpreter for the rest of the recording. Okay.
Okay. Great.
All right.
And it's pronounced Alicia?
Yes.
Yes. Okay.
And Rose, can you pronounce your last name again for me?
Angelosi.
Angelosi. Okay, thank you. And Ray Donald Leger.
Right. For the purpose of the presentation, just refer to me as Donald.
Donald,
It's
okay.
just, yeah, it's just easier.
Okay. Thank you for making my life easier. 'Cause
Hey.
Bambi doesn't do that. Oh, can she hear me?
Oops, too late.
Yeah. Open mic.
I don't know if y'all saw, I sent the slides to y'all this morning that y'all can.
Yes, ma'am. Yes, ma'am.
Okay.
Thank you.
All
I'm
right.
sorry, I thought I responded.
Oh,
Great.
I've been ignoring my email this morning. So.
Oh, you were ignoring me? Okay.
Well, I was trying to, remain focused for this. So
Gotcha.
I've looked in there a little bit, but I don't want to dive too deep in the email right now. That's dangerous. So,
That'll come afterwards, right, Rose?
yeah, I did just send you something, Ray.
Okay. Well,
I did get a fax that passed that along to you.
okay. I'll check it out. We're done here.
There'll be more later because I see people have sent things. So. More
Yeah.
coming your way to look at. Oh.
And Ray, you have a hello from Robbie Gray in the Q&A.
Okay. See Robbie in a minute.
So when we start, are we going to do our descriptions first and then launch into the presentation? Is that how we're going to handle this?
Yes, ma'am.
Okay.
And you guys, we have about 7 minutes before you start. So if y'all want to turn off your cameras and mics, and until then, you could do so.
Mute stop video participants. Apps with real-time match. Meeting information button. Apps with real-time match. Blank. YouTube button drop down. Full speech. View button. Annotate button. View pair with a YouTube button drop down. Quickly annotate. Mute currently unmuted.
we're gonna get started in about 1 minute. If everyone wants to turn on their cameras.
Mute.
Good
Currently
morning.
mute.
Good morning, everyone. My name is Alicia Valiant with the Governor's Office of Disability Affairs. I'm an African-American woman with mid-shoulder length brown hair. I have on glasses with a black frame, gold earrings, and I'm wearing a leopard print dress. Our next session today will be how Social Security disability benefits planning can support a successful transition to work. The presenters will be Dr. Elizabeth Fussell with Lighthouse, Louisiana, Rose Angelosi, and Donald Leger with LSU Human Development Center. You can read the description for this session and their bios on pages 22, 23, and 24 of the conference booklet, which is linked in the chats. Presenters, I'll turn it over to you.
Good morning, everyone. I'm Liz Fusel with Lighthouse, Louisiana, WIPA project. And just so you know, I'm a white female. I have short brown hair with dark brown glasses. I'm wearing blue today, and I'm so happy that you are here. We have a lot to cover in a short time, so we want to get right to it. Ray, do you mind to advance?
Yes.
Okay.
Hey, you guys, this is Bambi. The view is showing the current slide and the next slide. You may just want to change it to where it's only showing the current slide.
Okay. We change that, please.
Okay, so while we're catching up, there are a couple things that we think that you're going to learn today, and that is going to be the different types of Social Security benefits. I know you've all heard of SSI and SSDI. Those are some of the things we will focus on. The next thing will be the types of work incentives that can help with your transition as you go to work. And then the third thing is your responsibility to report to Social Security. That is critical in this whole piece. So what is WIPA? You know, we can't do programs without doing acronyms. And so when we break it down, WIPA stands for Work Incentives, Planning, and Assistance. And what that is individualized, employment-focused benefits counseling for people who receive disability benefits and are going to work, so that you understand what is going to happen once you go to work and you have earnings. So this program is funded primarily by Social Security Administration, and it's a critical component of the national effort to improve employment outcomes for Social Security disability beneficiaries. So as I stated, WIPA is about employment. The mission of the WIPA program is to promote employment and financial independence. So as you're going through the process, we're going to be looking, are you working? What type of job do you have? Meaning, what are the hours you're working? What is the rate of pay? Those are important pieces for us. And then throughout the process, you will learn all of the different pieces that will help you with your financial independence. One more slide, Ray. So what can WIPA do for you? When you sign up for WIPA and you ask to be referred to a program, you will be assigned to another one of those words, a CWIC. A CWIC is a community work incentive coordinator, and they will help you walk through the process. The first thing they're going to do is verify all of the benefits that you have and try to gather information about those benefits. The next thing is to identify if you are looking for assistance with employment. So we'll help you identify employment services and supports to overcome some of those barriers that you have towards employment. The next thing is to help you understand how that employment and the income earned will affect all of those benefits. So that's your Social Security, your insurance, state and federal benefits such as SNAP or housing, all of those key pieces we're going to pull together. And at the end of the day, the hope is that you will be able to manage all of those benefits and look at what types of work incentives will help you in that process. Some other things that we're going to do, and I touched on that a little bit, the responsibility of reporting your wages to Social Security. And then the whole key of managing your benefits over time. So as you report, as you're watching your benefits, you're watching your income, we're going to give you tips and tools on how to maintain that information and continue reporting and knowing where you sit with your benefits. We're going to look at your health care and see what is the best coverage. Will you maintain coverage? How long will that coverage be? Do we need to help you look for other areas of coverage? And then finally, to resolve any benefit problems that you encounter. So one of the things we like to say in our report to you is, if you receive a letter from Social Security, call that CWIC and let us know what the letter says so that we can better help you in that process. So who is eligible for WIPA services? So the first key is that you have a disability that is under Social Security's definition, that you are receiving one of those Social Security disability benefits. And I mentioned two of those, which might be SSI, and then one of the Title II benefits, and I mentioned SSDI. The next key is that you are age 14 and not yet retirement age. So all of those pieces are critical to the eligibility process. And at the end of the day, the message is employment and Social Security benefits can work together. And that's our role to help you understand what that's going to be, to give you the information that you need in order to make that informed choice of this is the route that I am going to go. It's possible to keep your insurance, and that's a key. I just mentioned that we will help you figure out what is going to happen to that insurance, how long will you have it? And then what are the possibilities of other insurance that you could search for and request? And then there is the fact that when you work, you will come out ahead financially, even if your benefits are reduced or stopped. And then the final thing is that there is a safety net, that if your benefits are lost due to you going to work, then there's a way that they can be reinstated or restarted when something happens that you have to stop work. And now it's for Ray. Thank you.
Thank you, Liz. Good morning, everyone. My name is Ray Leger. I know you do see the name Donald. I tend to go by my middle name. There's a big story behind that, but we'll get to that at some other time. We'll begin to discuss. Oh, let me describe myself. I'm a Black male, short, gray and black hair, and I wear glasses. As Liz mentioned, we'll be discussing the two benefits program distributed by Social Security, Supplemental Security Income, or SSI, and Social Security Disability Insurance, known as SSDI, but CDBs, which is Child Disability Benefits, and Deceased Widows Benefits, are also a category of the SSDI program. Let me begin by saying I'll discuss supplemental security income, and my co-presenter Rose will discuss more about the SSDI program. I wanted to say that supplemental security income is or has always been meant to be supplemented by wages from employment. It was never intended to be a standalone benefit that is able to support the individual during a given month. So the intent was always to have work be incorporated with those individuals receiving this particular program. It is a need-based benefit program. You're normally eligible for SSI because you don't qualify for anything else under the Social Security rules for benefits. The federal benefit rate is the maximum amount a person can receive in any given year. For 2023, that maximum amount is $914 a month. As I said, $914 a month is very difficult for an individual to be able to subsist on. SSI is adjusted by gross income that one earns during the month. And Social Security adjusts that benefit based upon the reported income that the individual informs Social Security that they're earning in a given month. By the way, if you do qualify for SSI based upon the work income that you earn, it'll take approximately 8 weeks or 2 months for the SSI benefit to be adjusted by Social Security. Gross wages during the month, an individual will have to earn at or above the threshold of $1,913 a month in order to lose the SSI benefits. Again, that's a lot of income for the SSI beneficiary. So unless you're earning at or above $1,913 a month, you're still going to be eligible to receive an SSI benefits payment. The only difference is that if you're earning below that amount, the SSI benefit check will not be $914 a month any longer. We have to explain to the beneficiary that based upon the income that they've reported to Social Security, the SSI will be adjusted down. We just don't know until the actual calculation is done by a CWIG to determine what that amount of SSI payment will look like. So even before Social Security begins to adjust the SSI, there are two exclusions that they apply to the amount of income that they're earning during a given month. The first exclusion is called the general income exclusion of $20. The second exclusion is known as the earned income exclusion of $65. Those two are combined together. Excluded from the total gross income for the month, divided by 2, and we'll look at exactly what a visual view of the SSI calculation looks like. Here you see a graphic of gross wages during the month. Now, let's discern between exclusion and deduction. Although the calculation is a deduction, it's just an exclusion of $85 from the monthly gross income. That subtotal then is divided by 2 to determine the exact amount of what an SSI payment will be for an individual. Here we have an example. An individual is earning $640 a month. That is the gross wages from the job. When you apply the exclusions of the earned and general income exclusion, Social Security is now considering $555 of the $640 the individual earned for that month. The remainder then is divided by 2. Of the $640 that the individual earned in a given month, only $277.50 is assessed by Social Security for the income that that person earned in this given month. That $277 is then deducted from the $914 SSI amount for an adjusted SSI benefit for that month of $636.50. So that is how Social Security determines the amount of how to adjust the SSI benefit based upon this person's $640 of income for this particular month. When you add the adjusted SSI of $636.50 to the gross wages of $640 a month from the job, the individual is now earning $1,276.50 per month, where they were only receiving $914 a month prior to entering the employment. So as Liz mentioned earlier, going to work with SSI monetarily is an advantage to you, especially since the individual is still, in this case, receiving SSI and will also continue to receive Medicaid insurance as a result. Work incentives. There are work incentives for both the SSI program and the Social Security Disability program. And keep in mind that work incentives don't apply to every individual who goes to work receiving supplemental security income or SSI. So the work incentives that apply to the SSI program include the student earned income exclusion, the impairment related work expense, the blind work expense, and the plan for achieving self-support. And I'll discuss a little bit more about each one of these work incentives. Only the SSI beneficiary can use the student earned income exclusion. It is for those individuals who go to work, are under age 22, and are regularly attending school, which means that they're in a learning or school setting for at least 12 hours a week for grades 7 through 12, or for 15 hours per week for individuals who may be in a work course while attending school. An eligible couple, both who are visually impaired, only one of those couples would be eligible to use this particular work incentive. In 2023, the maximum amount per month for the individual to use this exclusion is $2,220 a month, or $8,950 a year. So what this means is, if I'm working, for example, on an SSI individual who's eligible for a student earned income exclusion, each month I'm deducting the gross earnings for that particular month from the $8,950 of annual exclusion. until the balance for the annual exclusion reaches zero amount. In other words, how the calculation goes is that the student earned income exclusion can allow that young individual who just entered the workforce that no matter the amount of income they've earned for a given month, Social Security will allow that individual to be able to receive the same amount of SSI, regardless of the income that they're earning from employment, until they reach $8,950 of gross wages for that given year. After this threshold has been met, then the individual's SSI is assessed as anyone else who may be receiving SSI and going to work. Monthly and annual student earned income exclusion amounts are adjusted upward each year due to a cost of living adjustment. So every January, just as you might see a 5 or 7% increase in what you received in SSI benefits in the previous year, the same thing happens to the exclusions per month or the annual amount for the student earned income exclusion, excuse me. The impairment-related work expense is related to the disability or impairment for which a person is receiving treatment from a healthcare provider. It's necessary for work. It's paid by the individual themselves and not being reimbursed by anyone else. It's paid in a month earnings are received. The expense must be reasonable, and only Social Security can determine whether or not a particular expense is reasonable. And the cost of durable items may be prorated over a 12-month period. IRRIs continue. Individual must have receipts to prove the expense that was paid. The determination of whether an item or expense may be deducted as an IRRI is made again only by Social Security. And the request of the determination it should be made in writing in order to appeal the decision by Social Security. Even though Social Security may deny the use of an IRRI or any other work incentive, there is an appeal process that can be requested to see if special circumstances might allow the individual to be eligible for this particular work support. Okay. Here's Debbie. She's receiving $914 a month in SSI, and she has some Medicaid. She began working for a social service agency, earning about $640 a month. Because of her disability, she takes paratransit to and from work, which costs about $36 for her in a given month. The calculation here, and I hope you can follow me here, is her gross earnings is at the top of $640 a month. We apply the general and earned income exclusions of $85 from her total. Her remainder is $555 a month. We add in the IRRI or the impairment-related work expense of $36 to this equation. Her countable income at this point is $519 a month. Now, what the IRRI does here in this particular formula is it lowers the countable income that Social Security is looking at to assess how much SSI that she's eligible for. Based upon the IRRI then, that is divided by 2, her countable income because of the IRRI would be $259.50. We subtract the $259.50 from the amount of SSI she normally receives. Her SSI, her adjusted SSI in this particular scenario is $654.50. As the caption and the arrow shows here, without the IRRI, her SSI or her adjusted SSI, excuse me, would have been $18 less if the IRRI had not been applied to this calculation. Her total income at this particular time now is $1,258.50 as a result of the IRRI, where it would have been roughly $1,236 if my math is correct, or generally close to that amount. So the ERE can be used again to lower the countable income that Social Security determines a person to have. The lower the countable income, the greater amount of SSI that the individual is going to receive. Here's the blind work expense. It is for, again, SSI beneficiaries who meet the definition of statutory blindness. It allows exclusions of any other work-related items that are paid out of pocket and not reimbursed. Blind work expenses do not need to be related to an individual's impairment. And again, it's only for the SSI beneficiary, no one else. Examples of blind work expense would include state and federal taxes that an individual has deducted from their pay each month, union dues, mandatory pension contributions, uniforms, and those are required to be purchased by the employee, reader services, driver services, cost of service animal care, child care, transportation costs. Even meals consumed at work can be used as a disregard for the blind work expense. And then the adaptive equipment that the individual needs that they must purchase themselves to assist them on the job. Planned for achieving self-support is the final work incentive for the SSI beneficiary. The PASS, as we call it, is an SSI work incentive, which allows a person with a disability to set aside income and or resources for a specified period of time in order to pay for items or services needed to achieve a work goal. PASS can be used for educational purposes, where in most instances, and if most beneficiaries receiving SSI understand, resources in excess of $2,000 can make them ineligible for the SSI and or the Medicaid insurance that comes with that program. The PASS is a tool that allows an individual to set aside resources in excess of $2,000 that would allow them to pay for educational expenses. Some individuals who can use the PASS for self-employment, where they're able to purchase equipment, rent a building to house that their business. They can do all of these things with the PASS. The tricky thing about the PASS is to make sure that whatever the contributions into the PASS account, and you have to share that account and the information about it with Social Security, that you're able to subsist on what is left from the SSI and the work income. You can't contribute, for example, SSI benefits into the PASS account. You can only contribute what you earn from employment or a portion of that, and other resources that would contribute to the eventual goal that you've stated to Social Security. Okay. And of course, we spoke briefly about Medicaid. That is the health insurance that is attached to the SSI program. You can, while employed, continue to receive Medicaid, whether you're receiving an SSI benefits check or not. The threshold for 2023 for an individual receiving Medicaid with SSI is $37,322 a year. I've only experienced a portion of SSI beneficiaries ever earning an annual income of $37,000 a year. Some do, but more than likely that is not the case. So generally, when I'm explaining to an individual about maintaining Medicaid, I tell them not to actually be to have Medicaid be a concern for coverage, because more than likely 90 to 95% of those Medicaid will continue regardless of the income that they're earning from employment each month. As stated earlier, assets cannot exceed $2,000 at any given month, or that could cost them their eligibility for SSI and or Medicaid. The exclusions, of course, for that would be one car and the home that the individual resides in. So to have, for example, a family or friend donate property, an additional home or car, those items could lead to the eventual elimination or eligibility for those benefits. The next slide. Rose, you're up. I'll go ahead and let you go ahead and take this portion of the presentation.
Okay, good morning. Oops. Somebody talking?
No, it's.
You ready for me?
Okay. Yes, ma'am.
Hi, I'm Rose Angelosi. Give a description of myself, a white woman with curly, graying brown hair pulled back in a ponytail. I have on a blue dress and a flower-shaped pendant with a white stone on a gold chain. And I have on 2 sets of headphones right now because I'm working 2 computers, and gold double hooped earrings. And I'm going to talk to you about the other benefit, Social Security Disability Insurance, the SSDI side of things. So this is an entitlement program that's funded by federal taxes, the Federal Insurance Contribution Act, FICA. You'll see that on your pay stubs, withholdings for FICA. To receive SSDI, somebody would have worked either 20 quarters before age 21 or 40 quarters for anyone else. Next slide. So these benefits are designed to partially replace income when a worker retires, dies, or develops a disabling condition that prevents them from doing substantial work. So these are benefits that are paid to retired or disabled workers, their dependent family members, or the surviving spouses and children of deceased workers. So for the purpose of today, we're going to talk about those benefits that are paid to disabled workers themselves, disabled adult children, DAC, or sometimes called CDB, or disabled widows, DWBs. Next slide. So there are a number of work incentives available to people that receive SSDI if they want to return to work. And some of these we're going to talk about today in more depth. The trial work period, extended period of eligibility, and then there's a post-extended period of eligibility. So that's I consider them phases that people move through in their return to work. There's also subsidy and special condition, impairment-related work expenses, which are the same as Ray covered with the SSI benefit. The impairment-related work expenses are available to those on SSDI, not the blind work expenses that were available for SSI. There's averaging and unsuccessful work attempt. So first, I'd like to talk about the various phases that one goes through. First is the trial work period, which is a time that people can really test their work skills while they're still getting their full benefits, no matter how much they earn, as long as they continue to have a disability. And if those earnings this year would be over $1,050 in a given month, then it would be considered to be using up a trial work month. And that amount is for anybody, whether they're blind or non-blind. So, all right, next slide. Okay, so trial work months, they don't necessarily need to be used consecutively. They really are looked at over a 5-year period. You know, does this happen? You get 9 of those trial work months available to you. So once, you know, we look at, does that happen 9 times within this rolling period? No other work incentives are used during this time, so any kind of gross earnings are all counted. So it could be gross earnings if you're a W-2 employee, or if you're self-employed or an independent contractor, net earnings from self-employment, looking at those earnings, but also for those that are self-employed, it's also based on the time that you put in a given month. So limited to an average of 80 hours within a month. So you receive your full benefit check, regardless of what's earned. And once you use those 9 months up, it's used up for that period of entitlement. All right, extended period of eligibility. So when that trial work period ends, this is a 3-year phase that they're going to start looking at what your substantial gainful activity level. They start measuring you at this level to decide if your benefits will continue or if they may be suspended. So the thresholds for these is $1,470 for people with disabilities who are not considered statutory blind, or $2,460 for those who are considered statutory blind. And that's one thing that we really look at to see how people are coded in the Social Security system to determine which rate we need to look at for substantial gainful activity. So during this period of time, if you are below that earnings level in a given month, then you continue to receive your benefits. If you're above, then you would not be due that benefit. Now, what you need to know is they're not watching that closely and turning it off and on in given months. So this is something that we as CWICs really kind of help you with, monitor whether you should be receiving checks or not. So you want to be aware, should you set that money aside, because you don't want to be overpaid because they want their money back. All right. Next slide. So the extended period of eligibility begins immediately the month after your trial work months. So once you use that 9th trial work month, you jump on this 3-year train, and that train is taken off and running whether you're working or not. Okay, like I said, if you go over SGA, benefits could be suspended, not terminated, but suspended. All right. So at this point, other work incentives can come into play. So things that can bring down what Social Security considers you earning. When determining SGA, that's a decision that looks at not only your earnings, but are there other work incentives that can help make that decision. So one that I'd like to emphasize today that I don't think people think about a lot is subsidy or a special condition. So sometimes when you're working, you may need some extra help from other coworkers or extra supervision. You may have a lower production rate. You may need a few more breaks than other people. You may not be able to perform all of the duties of the job that the employer is offering. So you may have fewer duties than other people who might not have a disability doing that same work. So when this happens, their wages pay for their work product or effort, but also the help of other people, or perhaps higher pay that might be received for the same work product. So sometimes people call this a brother-in-law deal, because maybe you're being paid more than your work effort might be demonstrating. I like to think about it as accommodations. you know, a lot of times we are given accommodations and jobs are modified. We do get some extra help from people from time to time. So this is a way of accounting for that. You know, accounting for the accommodations that we receive that really is of some value to the employer. And the subsidy that the employer ranks you, you know, needs to be realistic, in line with, you know, what is your work effort and what are the accommodations being put in place. All right, so how subsidy works. I just want to give a little example here. So say there's somebody receiving SSDI and they're going to work at a gas station convenience store. Their monthly earnings, if they're working like 40 hours a week, so say their earnings are $1,732 in a month. Well, that's over SGA, right? So their duties include cashiering, you know, for the most part, but then there's sometimes they have to go stock, you know, restock the fridges with the drinks, and also go out and measure how much gas is left in tanks. And this person has some lifting and bending restrictions. So they can't really go measure the tanks easily. And they also have difficulty lifting, you know, restocking, lifting heavy things and, you know, putting them on higher shelves. So those are some things that they really aren't able to do. So when I talk to the beneficiary, you know, if we think about the time that might takes, it might be about, you know, 25% of their time really spent there could be doing this if they were taking on these tasks. Okay, next slide. So by not doing these, if you think about it, he has less duties than somebody else in that same position. So it requires some other employees to come perform these tasks, you know, restocking the shelves. And someone else had to take on the measuring of the tanks. So if the employer would rank them, say at 80%, considering that this is like 25% of their job, 80%, Social Security, you know, would consider them earning 80% of whatever their actual check is. So 1732 times 80%, 1385. So at that point, they might be considered under SGA in Social Security's eyes. All right, termination of benefits. So if somebody moves beyond that 3-year phase, you know, if they're under SGA, benefits still continue. But at that point, if you're working over the SGA level, benefits would terminate. And that means that the computer record that maintains the payments is terminated. And it's the end of the period of disability entitlement. So once they're terminated, you'd need a formal reentitlement or reinstatement decision to start receiving benefits again. Okay, next, expedited reinstatement continued. So this is a 5-year period that lets you jump back in relatively quickly in the system without putting in a totally new application. So if somebody stops working because of their disability, you know, because of the same, you know, the original disability in which they were qualified, or if they have some kind of reduction in their work. So it has to be related to the original disability. And you have 5 years to do this once payments are stopped, right? Okay, so when you try to go through this process, there's 6 months of provisional payments while they're making a decision to see if they're going to reinstate you. And you must be currently unable to do SGA level work. And if one is reinstated, if you go for 24 months, staying under that SGA limit, then you are granted like another trial work period, another extended period of eligibility. Things start over, the whole cycle starts over. And this is the initial reinstatement period. All right, Medicare. So SSDI beneficiaries ultimately get Medicare, sometimes immediately, but for the most part, 2 years in to receiving benefits. And this can continue even if one's working and benefits are suspended or even terminated, your Medicare can continue. There's an EPMC, extended period of Medicare coverage. And this can last at least 93 months after the trial work period ends. So other things that we look at besides the healthcare and your actual Social Security benefits, we're also going to look at food stamps, SNAPs, any kind of subsidized housing assistance, Medicaid waiver eligibility, unemployment, workers' comp, VA benefits. Look at how any of these things are interacting with work and any impact of work on these things as well. And on this next slide, work incentive resources. So these links will point you to some of the things. So the SSI calculation sheet that Ray went through, that example earlier, we have a blank sheet that you can work through. And impairment-related work expense request forms. So it's very important to document those and save receipts. And some information on pass and so forth. So I'm going to hand this back over to Liz, right, to talk about the importance of reporting.
Yes, thank you, Rose. Just to remind you that each person that we work with, we provide individualized information. So it's very difficult for us just to answer a general question about, does this happen? So because we're gathering a lot of information about your specific situation. So when the package is complete, and we're going to try to help you to understand how is it that you report to Social Security. What I like to tell people is that this is about communication. All of these work incentives are in place, but you have to have that communication with the Social Security office in order for the work incentives to work. And part of that is reporting your earnings. Now, reporting your earnings is different, slightly different for SSI and SSDI. If you have both, you have to report twice in 2 different areas. So the key points is that you are going to have your pay stubs ready to report by the 6th of the month following when you receive those pay stubs. Your first report is going to be by telephone and follow up with your cover letter and pay stubs. And then from there, you have several options of how you can report. And they're listed there on the screen. You have phone, mail, fax, deliver in person to the office, telephone report, use an app on your phone, or create your own My SSA account. And the thing I like to suggest is that with that communication with the Social Security office, that you are asking them, what is your preferred method? Because again, if you are reporting and that information is not being handled, then we have an issue, okay? So next slide, please. Some of the same key pieces for SSDI is, again, you're going to report by the 6th of the month. But the thing here is you may want to look at that My Social Security account. For both areas, you're going to want to have that employer identification number on there. With the My Social Security account, you can enter that, you can upload your pay stubs, and it provides you a record that you have reported your income. And then just always be advised that you need to have communication with that person at that Social Security office so that they're watching for that and they're looking for it and they're updating the record. So you have 5 or 6 different ways that you can report. Just be sure to communicate that with the person at your local office. And I think that's it, right?
Thank you, Liz. I'm trying to advance to the next slide here. Okay. Just to follow a little bit what Liz was saying as well, we do advise the individual to keep their check stubs. Despite the reporting, there may be occasions where Social Security may request an 821, which is a going back of sorts to accrued past income. And sometimes we as CUH will be proactive in getting the beneficiary or the recipient to go ahead and fill those out and submit them to Social Security. What you see on screen now is our coverage area for both Louisiana Lighthouse WIPA and West South Central WIPA with LSU. LSU is covering the purple shaded areas of the map, and Lighthouse Louisiana is covering the white or light colored areas of this map shown on the screen now. How to refer to WIPA? You can do it directly by calling the WIPA hotline at the toll-free number that you see there. They're available to take your calls Monday through Friday from 8 a.m. to 8 p.m. That would be 7 a.m. to 7 p.m. Central Time. And for general ticket to work inquiries, you may email them at the support@choosework.ssa.gov website here. Here's the contact information for Rose, Liz, and myself. Excuse me, for Rose and Liz. I'll show Liz's contact information in a moment. Here's the West South Central WIPA contact information, our email addresses. For providers, we don't mind taking direct contacts from you using our email addresses. If you're referring individuals to us for assistance, the ticket to work hotline number that you saw on the previous slide would be the best way to get to them. LSU also has a beneficiary referral form on our website at the link that you see on this particular slide here. Here is Liz's contact information with Lighthouse Louisiana. And then I'll go ahead and just give you this disclosure that this presentation and associated materials were developed at U.S. taxpayer expense. These do not constitute an official Social Security communication. Okay. If we have time for any questions, we can go ahead and do our best to answer those now.
We do have a few, Ray, if you guys do have time.
Sure.
Okay. From Dr. Mitchell, if I am in an educational program and or have a job that requires online access, can I exempt the cost of the technology, software, hardware, one-time expenses, and the internet services monthly charges which options do I have? Is it related expenses, past, whatever? How does this differ from SSI and SSDI?
Well, it is possible to use those expenses as impairment-related work expenses. We would have to see if Social Security would approve those expenses. Now, keep in mind, the impairment-related work expenses is used for SSDI to lower countable income to maintain the benefits. For SSI, it's the lower countable income to receive a greater amount of SSI. So it depends on which benefit you're receiving and whether or not Social Security is able to approve the expenses that you are asking about.
Also, like if in a work situation, somebody might be self-employed, it might be a business expense.
It could be. You're
Yeah,
correct, Rose.
like the internet and phone, gig economy workers are deducting that as, part of their expenses.
Okay, another attendee asked, so even if the person is getting paid the $1,735 because they are not able to perform the duties, SSDI would allow for 80% of the salary to be counted?
Yes, Social Security would consider that the employer fills out a subsidy form of what they feel that the employee, their work effort is, and they rate them on a percentage, between 1 and 100%, and mark what kind of accommodations they're providing. And Social Security could accept that and regard them as earning the lower amount.
Okay,
Even though
thank
they're
you.
bringing home 1732.
And one last
Right.
question, I'm sorry, Donna, you want to add something to that?
Well, the disregard could be less than 80%, or it could be more than 80%. It just depends on the rating that the employer rates the effort by the disabled individual doing the same work as a non-disabled individual. So the countable income then could be much less than the 1735 or the
Right.
1385 that we listed earlier in the example that Rose had used. Yes, ma'am.
I've seen people rank as low as 50%, to where only half of their earnings are actually counted by Social Security.
Okay, and one last question. When someone becomes eligible for SSI or SSDI, when are they provided with information on these work incentive programs? First-time beneficiaries are not usually aware of their existence.
Generally, when they call Social Security about wanting to go to work, Social Security will refer them to the WIPA that is in that particular state. That's how most of the referrals are generated for our programs. If they contact their local Social Security office and tell them they have an interest in employment with these benefits, they'll be directed to contact us.
Thank you so much, and thank you for staying over. I think our attendees are aware that you guys are a wealth of knowledge, so they wanted to take full benefit of this opportunity. So thank you, Dr. Fussell, Donald, Rose, very informative. Our next session starts at 12. So we're gonna ask everybody, just go grab some lunch and come back and meet us at noon. You can remain.
Video participants.
You may remain logged on. The title of the next session is Computing for Youth with Autism. Once again, thank you to our presenters.
Screen record.
See you guys at noon.
Meeting information button. Apps with real time. Flag. YouTube button drop.
Hi, Sterling.
Hello.
You want to check out your mic, get video, and if you have a PowerPoint, you can do that now.
Okay.
Okay.
Hi, Sterling. We're gonna get started in about 10 minutes. If you wanna check your mic and your camera before we get started, that'd be great.
Okay, we're trying to set up the presentation, so, but the mic is working. Hello? Hello?
Yes.
Do you guys see the PowerPoint?
No, we see basically the file,
Okay.
all the files.
It's
on this
actually
laptop.
up on my screen. 1 second. Okay, what about now?
Yes, we could see it.
Okay. All right, thank you.
Okay. And if he wants to try, turn on the camera, make sure that's working.
I'm not Sterling, but it's working.
Okay, very good. Whenever he gets started, you can go ahead and take the presentation down, and then we'll do an introduction of him at noon, and then he can put the PowerPoint back up.
Okay, thank you.
Thank you.
Well,
I will get started in about 2 minutes.
Testing 1, 2, 3. Can you hear me okay? Testing 1, 2, 3. Can you hear me okay?
We can hear you, we can't see you.
Okay, now can you see me?
Yes,
we
sir.
can.
Okay, all right.
And Sterling, I'm going to do a quick introduction in about a minute, and then I'll pass it over to you.
Okay, this may not take 50 minutes, but well, I guess all the questions and answers that it may come up to the 50.
Yeah, we'll
Okay.
have time for that as well. So that's fine.
Okay.
Great.
Okay. Is Miss Henry on board? How you doing, cuz? Hi, cuz. How you doing?
How are you?
I'm doing okay. I'm doing okay. I laughed. I told my wife, I said, look, I got cousins all over the place. She might be related.
I said the same thing. I'm looking forward to your presentation. I'll let y'all start though.
Well, it's not going to be no big thing. We're just trying to do good work to get jobs for kids who have autism. That's it, and that's what we're trying to do. And we've got a full-scale effort going on, and please don't hesitate to ask any questions, even directly from YouTube, because maybe it may churn other people to ask questions and encourage other people to participate in the program.
Yes, sir. Well, I'll hand it to you, Liam.
All right.
Hello, how you doing? Okay.
Good afternoon, everyone. Our next session will be Computing for Youth with Autism. The presenter for this session will be Sterling Henry Jr. He is with Computing for Youth with Autism and Families Helping Families, NOLA. You can read the description for this session and his bio on pages 24 and 25 of the conference booklet, which will be linked in the chat. Mr. Henry, I'll turn it over to you.
Hello, how's everybody doing? It's an honor for y'all to invite me and my office to participate in this program. I just want to say a quick thing that, Families Helping Families is an organization that I just recently started working for. And I've really appreciated the time and the energy and the commitment this office is to the disability community of the city of New Orleans and in New Orleans metro area. They've hired me to do something which I find very, very challenging and very rewarding all at the same time. And that is to basically help find job and employment opportunities for folks who have autism in the city, in New Orleans area. We have a program called the CYA program, called what they call Computing for Youth with Autism. And our job basically is to provide training for youth who have autism, as well as then after they've completed the training, to try to find and secure some employment opportunities for them in the IT field. Now, let me show you how it starts. We have this program called the Learning Lab, which we have at our office every Monday, where kids come in, where they can learn about what kids with autism can come in and they can learn about, all types of things. And we basically look at them and review what they're doing and their computer capability and their ability to do things on the computer and online, which is wonderful. And we try to work with them on that one and see, but with that, we assess them. And after we've assessed them, we also pass on, we forward to them some possibilities of them in the IT area and their field. And one of the things that we do is let's say the person wants to be a graphics designer. I mean, there's a program that we send them out to that particular program. Suppose the person wants to be a coder, a computer coder, or an animating person. We would send them out to a program where they would have that particular area and skill. And after they've gotten that particular training, now there's about 7 other training areas in the IT fields in which they can participate in. But mostly it's designed so they could do the program and then ship out to another, go to a training program and then complete the training program. And then after they've completed the training program, they can then we can start working with them on trying to get a job. And that's what the program is all about, called the Computing for Youth with Autism. And that's what we're doing. That's what it's all about. This is just an example. What you see on your screen right now is the program we have and a brief description of what we're doing on that particular program. But we take various kids on the spectrum of autism, you know, get a better understanding of what their computer skills are, and basically send them to a training program that works with them and improves their skills and basically puts them in a situation where their skills are now employable. They can go to various fields, various companies, in the various aspects of IT. And that's one of the things that we're looking for in that particular program, and we try to advocate for them in the program. Our mission is very clear: to serve this particular community. We have a grant that provides that particular work and that services to them at no cost to the student who's participating in the program itself. And that's very helpful because the kids need to know that they can come in without this being a financial burden on them and or their family. So that's one of the things that CYA does. You know, the challenge is very simple, as we put inside of the slide. There's a lot of folks in the United States that may have a degree of autism. And as my slide was saying, there may be 1.1 million folks who may have it. And, you know, and the bottom line is that the majority of them are not in a situation where they are making enough money or have a job opportunity to make them self-sufficient. Our goal and objective is to get them in a field where they can actually provide them with a job that they can be self-sufficient. That's our number one goal and objective. Now, we're going to center most of our job opportunities for those citizens in the city, those folks with autism who are living in the New Orleans metro area, and we try to find jobs for them in this particular area. But I'm not limiting myself, even though we've just got started. We may even go outside of the city of New Orleans to find some additional job opportunities for them. But that's just some of the things in which we do to get them ready for that for their job. You got to be trained, you got to be certified in something, and then we can go out and shop you and try to find the job opportunities for you. You know, we help all types of individuals with their skills and their program and their abilities. And that's what we do. And I mean, I'm not saying everyone is accepted into the program. I'm not saying everyone is going to be moving forward with their program, but I'm surprised by how many have gone through the program after we've done an assessment to them and then move them on to a training program that fits for them. And I'm very proud of that. And our staff is very knowledgeable for it. I think I have two of the best staffers in the country who can actually look over and review what the capabilities are for the students and basically make a very good recommendation to them on the type of training program that's up and available. You know, our program is a little different because we're specifically targeted toward folks with autism. And that's the key component of it. We don't, you know, there's some other folks with some other programs that we work with, but there is not another program dealing with computerization and autism in the city of New Orleans and the New Orleans metro area. So that's one of the things in which we're doing, and the difference we have, you know, about us as an organization. This is how the program works. We have all types of participants. Our compensation comes when we do our program is from LRS. And we try to provide them with the best quality training program and training options that they have available for them, okay? You know, these are some of the types of job opportunities in which we'll try to provide a training program for them. Like I said, video game design, computer animation, web design, web development, computer programming, elements of computer science, general IT work, information and data management, data analysis, and cybersecurity. I'm even trying to add another component to the piece, which I will not mention on this page, but I think it's a very interesting component that we have. And these are our partners, our educational partners: Delgado, New Horizon, Nunez Community College, Operation Spark, Hack the World, Tulane University, and Delgado University. They're doing a great job at providing the training that our students need in order to get them to that particular program. And that's where we are. Now, the participants in the program are, you have to participate in the program, you got to be between the ages of 16 and 25. You have to have been diagnosed with autism on some level of the spectrum and a citizen of the state of Louisiana and eligible to participate in the program via the Louisiana Rehabilitative Services Program. You know, you have to be interested in the area of computer. That's what we're basically keying in on in reference to the training as well as the job opportunities that we go out and seek. You know, our opportunities for partnerships is very, it goes a spectrum. Now we've been communicating with companies throughout the New Orleans area and signing partnership agreements with them so that they can look at our students in the future. When a job becomes open in their area or on their job site, what we encourage them to look at our kids and participate and to review our kids, to have our kids you know, reviewed and looked at very closely, because to be honest with you, many of our kids don't interview as well. And we will help them in reference to going to maybe providing an alternative interviewing technique for many of the students. We provide some assistance to the company in working with the kid and setting them up and getting them their accommodations on the job itself. There's a lot of work in which we provide to the company, and that's why the partnership works, because they're looking to bring good employees. It may be new territory for them, and we help them go through the maze of hiring and not just the maze, but some of the ups and downs of what it may entail about hiring a person that may have autism. And we know they're going to be good employees. Except that sometimes when a company who hasn't experienced this, they may get a little nervous. And I think with the services in which we provide them, it can ease that burden a great deal and make it more palatable for the company to hire and continue to hire additional people with autism. You know, the benefits of it goes without saying. First of all, I think the companies benefit because they get good employees. They get really good employees, people who come to work on time, on schedule, who value their job. I mean, there's some studies out there talking about the absentee rate of folks with autism who are on the job is like almost insignificant in reference to their overall numbers, much better than you have with your average employee. And it also talks about their dedication to the job. You don't have a lot of turnover in that particular area. They keep their job, they work really hard at the job, and they value that job tremendously. And we also try on an ongoing basis of trying to show the company that it's to their benefit of bringing that person on board because they have a very good employee. Now, to the person that's employed, it helps them become more self-sufficient. That's the key component. Being self-sufficient is a part of everyone's dream, is to be self-sufficient, to be on their own and not to be dependent upon anyone. And the job is the route to do that. We figure with this program in this computer area and field, they will be making enough money in order to be self-sufficient. And that's the key component. That is the key component of us making their situation, putting them in a situation where they'll be self-sufficient. And we take a lot of pride in that, and that's one of our major league goals and objectives. You know, we have this learning lab, as I was trying to say. The learning lab is a very interesting process. I've learned to sit back and observe it. I honestly do not personally participate in the learning, but I've just observed it. But it's just interesting to see the students participate in various tasks that goes on in the learning lab, at various activities that take in the learning lab. And I noticed how the staff works with them. But I didn't realize, and it really taught me a lot about that as part of their evaluation. And learning to make a good evaluation on a person's ability to manage or to work on a computer program or have the exact extent of their interest in computers is very, very interesting. And they can do that at the learning lab. And I think the staff, after 2 or 3 sessions, really has a pretty good understanding of what that capability of that student is. And that also helps us because then we can recommend the proper program for them to go to in reference to training. And with the right training is when they can make the next step to the permanent job that we'll try to help them get. You know, the employees work, they benefit from it. I went through that in the program itself. Here's a listing of some of the things that they do: increase retention, increase recruitment, high morale. You know, they think out of the box. Many folks with autism think outside of the box. Employee will appreciate that. And in the end, you know, you're always looking for a different perspective on how to improve your job, how to improve your business, how to improve the product that you're making. And I think it also boosts your company's morale and reputation. It shows that you're making an effort to bring in people who normally would not be hired or be considered. And I think that's a good plus because that community appreciates it and they do business with you in the end. So the benefits of partnering with our program is vast. There's some tax breaks that's associated with the program. There's a lot of good things that can, you know, happen for your company. We provide as much support as we can provide for you on that one. But I think the overall thing is your bottom line. That company's bottom line increases because they get a good employee, a good person that can really make that company more productive, make it more efficient, and make it more profitable. And that's the key component of any business. So that's basically the elements of my presentation itself. I just wanted everybody to say that this is what we do at this office. If you have any questions, let us know. If you have a person who you think could participate in our program, let us know. If you know of a company that's interested in hiring a person in the IT field of one of our folks, we would love to sign a partnership agreement with them. So please, my number can be reached at the website in which we have on. You can just dial. You can dial me directly if you choose to, and that's at area code 504-220-2089. Or you can go to our website where we have as fhfnola.org, and that's fhfnola.org, and that will get you where you got to go in reference to the site, some information about the office, and that's Families Helping Families, NOLA. And we can, someone will be able to direct you to my office or directly to one of the folks on staff that can help you with your child or yourself. You may want to participate in this particular program. But remember, we're only bringing in kids who are between the ages of 16 and 25. So just remember, we don't have the whole spectrum, but between 16 and 25. So just take that in mind with the program, and it will be part of one of the things I would encourage them to do, just come to the Learning Lab and actually come in one Monday and actually participate in the program, see other kids like it, and let us look at your computer abilities and some of the things you can, and maybe even some of the things you can't do on the computer. And we'll find all that out and try to get you and direct you into the right training program that can help you become a computer person or an IT person that has a job. So any questions, please let us know. Let me know. I'm here. I know it was a very short thing, but you know, this is my colleague, you know, Tiffany. She may be online right now. She's working the program itself. She's one of the people that you will talk to. Her email address is right there on the bottom. You could use her there. Okay. So any other questions, just please give me a call. And I'd like to ask any questions. Go ahead.
Hi, Sterling. We do have a couple of questions.
Yes.
Rob says that this program sounds great. How will it be relocated here in Northwest Louisiana? So is there an opportunity to take what you're doing in New Orleans and copy it up there?
That's something that's a little ways away. We're not there yet to handle those services for others. That, believe me, but that's one of my golden objectives at this time next year, that we'll be able to expand it out to that particular area. Okay, but right now you have to be. We're concentrating our efforts in the city of New Orleans and the New Orleans metro area.
Okay, And Melanie asks if the local Families Helping Families offices participate in this, or do we have to go through the NOLA office? So I think it's the same question, sort of just say right now it's specific to New Orleans.
You know, and tell her, to be honest with you, you see Tiffany's back contact information is right there on the page. Tell her she can email her, would answer any and all questions about the program itself and her options.
Okay. And I think the last question we have, other than a request to put the information in the chat, which we'll do in just a moment, is there a website for the program?
Oh, yes. You could just go, like I said, to FHFNOLA.org. Okay. You can go to FHFNOLA.org. You'll see programs and you'll see CYA. It stands right out there. You get all the information you want from that particular program inside. Or you can email Tiffany at that address, and she'll send you the link to the directly to the program portion of the CYA activity. I've just come on board. Tiffany's been on board a lot longer than I have.
Mm-hmm.
Okay, any other questions?
Sterling, this is Bambi. I have just a question in regards, and I'll turn on my camera so you're not just hearing a voice from the sky.
It was from the sky. It was from the sky.
Thank you so much for your presentation. I mean, you really shared, the content of it was great, and the practices that you talk about is on point in regards those of us who know what are best practices around hiring people with disabilities and the benefit to businesses. So I really appreciate that, and your passion for it to me is a great selling point. So I just thank you for that work and your passion.
Well, we're trying to get as many Louisiana businesses that handle computers and the like. For example, one of the things that we did a good move, and I saw early in the program you were talking to Ashna. You know, Ashna is potentially being one of our partners. Matter of fact, our meeting went so well last week. I had forwarded them the partnership agreement, and they just sent it directly to council so they can get it all straight. And we'll probably have them on board in the next week or so. So I'm just very excited about that because they have jobs that's available. They were very interested in some of the accommodations and some of the things that we could provide them to help with the transition of the student being in that, the new employee being in that position. So we're excited about that. We're looking at a partnership agreement with the city of New Orleans in their ID department. We're very close to finalizing the arrangement with the chief contractor for the city of New Orleans is IT department. And that's a new company that's coming into town, but they're very interested in it. And they'll have 60 to 70 jobs that's open and available for them. I'm not saying all that's going to be us, but I'm just trying to say that they have positions and they can even hire people even faster than the city itself can in their IT department.
And just a follow-up question. I think it was someone else had a question earlier about replicating it in North Louisiana. I'm just wondering, are you guys keeping data so it could be replicated, even if it's not you guys? If you have best practices, and it just sounds like you're really reaching out to the businesses, you have a really great program in place. Are you guys doing any kind of data collection to be able to show people how this best practices can be replicated?
I have been on board for 4 months to work this program. So the answer to your question is that is a goal. And we have some people that's doing and I'm collecting as much data as we can right now. In fact, I've just brought on board a person who's going to be helping me with my additional partnership agreements and putting together the presentations that we're going to be sending out to the companies. But yes, we hope to have this at a point where we can take it and give it to another organization and say, hey, you can run with it, or we'll be able to take it and be able to say, let's expand it out to another part of the state. You know, that's our ultimate goal and objective, but I'll be honest with you, I think we're a year away from that, to be blunt.
Well, we appreciate that. And Liam, if you want to come back on, and I see we have some more Q&A, and if anybody else has any questions, they can definitely put it in the Q&A.
Well, I'm here to answer any and all questions that you have. I've been ordered to volunteer to assist in every way, shape, or form.
Absolutely. I did drop the website for Family Self and Families NOLA in the chat, so that should be available. We do have a
Thank
question
you very much.
from Mary Robert, who says it would be good to work with the school districts as well. Have you considered Lafayette Parish School District or other high schools as a training program?
Well, one of the things that we have been using the school system is a section of recruiting kids to participate in the program itself. And that's one of the things we've been making some outreach with the New Orleans Parish School, the St. Bernard Parish Schools, and some of the other school systems in which we have in the New Orleans metro area to find and secure kids who have an IEP and also would like to who have shown some computer skills and get them involved with the program. That has been part of the source in which we use right now. But the training programs itself are not done at a high school. The training programs are done at Delgado. It's done at Operations Park. It's done, some of them are done virtually. But what I'm just trying to say is that, so the outreach to the high schools has been mostly from a recruitment standpoint of getting more students involved. Next question.
We have one more question. It says, are you in Jefferson Parish or West Bank, or on West Bank? I'm sorry. On West Bank.
We're not in Jefferson Parish. We're in St. Bernard, Orleans, Plaquemines Parish.
Yeah.
Hopefully we'll be in Jefferson Parish soon, next year.
So that's all the questions that I currently have. We do have about 20 minutes left. We can certainly wrap up early, but if anyone has any additional questions before we do end early, please ask them now.
I mean, I think one of the beautiful things in which we have in our program is that our goal and objective is to provide job opportunities to the kids. I wish I could wave a magic wand and it would happen overnight. But the fact of the matter is we all know it's not. But we're going to try. We're putting our level best and our best foot forward about providing those job opportunities to those kids. But, you know, you got to get through the training program. And that's the thing. You got to get through the training program. And we'll try to find a program that fits your needs or what you want to do and try to develop a training program that you can get through. And that's the key component, because if the person doesn't get through and have the certification, it becomes more and more difficult to employ.
And we do have another question from Rob. He said, how did your organization select this type of disability?
I'll be honest with you, I don't know. I've been on board only for 4 months. I think my boss was part of the reasons why we have the program. She has, her name is Aisha Johnson, and Aisha has 3 children that all have autism. And she also noticed how they play computers, how they were playing on computers and how well they were doing on computers. And she had an idea about the idea of what's the employment opportunities for them because of being able to work and to manage computers. So her and the development director at our office put together a package of material and shopped it as a grant. And we got funded for the program, and that's how it started. Now, I think we ran into a roadblock because of COVID. And I think most of you have run into a roadblock called COVID. And so much of the program went virtual. Now, I'm not exactly certain how successful the training was under those aspects of COVID. But since that has now been released, I'm dedicated to make sure that the training that the kids get are at a point where the kids can actually get a job. And that's our dedication, and that's our field, and that's what our goal and objectives are. I am aggressively knocking on doors, talking to companies about the idea of hiring out people and becoming a partner. And so far, I mean, I've only been on board for 4 months, but I think we got nearly 10 partners right now. And I'm looking at getting more as the months go by. Question.
Liam, may I ask a question?
Sure.
Mr. Henry, what about the families of your students? Is it easy to engage them? Are they very supportive? What type of feedback are you getting from the families also?
I'll be honest with you. I personally don't deal with the families as much as the staff does. Okay, they interact with them a great deal, and they give me great feedback that many of the parents are happy or are excited about the fact of the matter that their kids can possibly get a job. There's a few interactions I've had with the families. Is one guy told me something that really touched me. He said that, Sterling, if you can get a job for my son, he said, this would be the equivalent of your son winning a Nobel Prize. I said, what? I said, yeah. He said, I really think it's going to be very difficult for my son to find some type of employment. When I said, well, sir, all I can do is, give it my very, very best. And, but that level of intensity it really got to me. The fact of the matter that this man has some hope that his kid may be able to find a job. Now, he has a limited hope, but he was explaining it to me how intense that could be and how important that could be to the long-term development of his child. So all I can say is we give it our best, and the parents I know are very appreciative if we can find them a training program and if we can find them a job.
And we do have just some general support for Jefferson Parish, saying there's a lot of kids with autism there, and I think CYA would be a great help there. What other parishes? I believe you answered this earlier, but just to reiterate, what other parishes besides St. Bernard and Plaquemine Parish are you in currently?
Orleans.
Okay, thank you. And then the last one of the last questions I have is, can students who are not from Louisiana enroll in this program, saying that they have a nephew who does animation and computer program who's on the spectrum, and the family recently relocated to Texas. So is it just Louisiana?
If the person has a relationship with LRS, we can work with them. But we would prefer that the person would be also have a relationship and they live in the parishes in which we're working with. We're not going to turn anybody down, but if they have them in that particular in the Orleans, St. Bernard, or Plaquemines Parish, we would love to have them there. But if they have a relationship with LRS, we may be able to work.
Perfect. Is another question that we have is there any possibility of having training program at Elaine P. Nunez in St. Bernard Parish for those who would this would help those with transportation issues?
I'm missing the question.
So is it possible to have a training program at Elaine P. Nunez in St. Bernard Parish, or how do you address potential transportation issues? Is there a virtual component to this, or are there other offerings for people who don't have?
Yes. One of the things that we do in the evaluation is when we evaluate the kid and try to recommend a program for them, we take in consideration, where the kid is located at, whether or not this can be done virtually, or whether or not, the program also matches the kid's needs at the same time. So all I could say to that is that I understand that transportation can be an issue for some of the kids participating in the program. And those are some of the barriers that we try to overcome for the student. And that will all depend upon the program that he that best suits him, and where it's located at, and what the capability is of that particular training program that we're looking at. So that's the best I can answer, is that we'll try.
And Mr. Henry, and since you're going through, these students are being served through LRS. LRS has funding for if they qualify for potentially for some transportation support, right?
Right. I believe so. My staff has been informing me about some of the things that LRS can do and provide for them. So my best answer is that, to be honest with you, is that I would need to get some information from the person and then have my staff work on it for them to see what options that we could have for the kid, to be honest with you on that.
Great, thank you.
I'll be honest with you. One of my key component is to knock on the doors is the companies and to get these companies lined up to start hiring our folks. That's my number one piece. I think my staff does a great job with the students themselves, an outstanding job. I mean, I think the dedication level is beyond what I had thought it would ever be. Okay, and so I don't try to mix with anything good. Like I say, if it's not broken, you know, it really is not broken. It's working very, very well. So I appreciate them and I appreciate their talent. And let me just knock on those doors and try to get more people to provide the job opportunities for them. That's how we kind of break up the responsibilities here. Mr. Dope?
Yes, I do have an additional comment and then a question as well. So Melanie says that coming from a family, from having a family member who's struggling with job opportunities with autism, this is a wonderful program that can tap into a market that is and can be rewarding on both sides. Is your intent to share with colleges and universities and partner with them either initially or further down the road?
Further down the road. I think we're going to keep what we got and perfect what we have and then move on down the road. And, you know, and for a kid who wants to go to a 4-year college and stuff like that, that's a whole different option set for that person. So we can look at that, and part of the evaluation with the kid may be that's the route you want to take, but it all depends upon the kid, the student who wants to participate in the program. And so we can move forward from there. I mean, it's not one box fit all. It's not that at all. So that there's a student who wants to maybe become a great computer scientist may need the four-year degree program. You know what I mean? And then go on to a graduate program and so. But right now we're talking about a different type of program that will be in a position of being able to get you a job much more quickly in the IT field. Go ahead, sir.
Yep, absolutely. And so Rob asks, what certifications does this program assist?
Well, it's all, most of the certifications are in the area of IT. As I said inside of the program, it's a various, I mean, you know, you'll be a coder, you'll be a certified coder if you want one program. You'll be a certified in cybersecurity if you have if you participate in another program. And the list goes on. And it was all part of the list that we had on the presentation of the various aspects of IT that we have. And I mean, I don't want to give an employee somebody who's not certified. You know what I mean? They don't have a level of certification. That helps them a lot in reference to being able to find their employment.
Great. And I have one more question. Claudia says that she spoke with a father last weekend whose child is borderline autistic, and the child exceeds in graphic design, visual arts, and in areas related to computer games. So her question is there a training lab for artistic children as well? As an
she should go to the website. She should go to the website and look at the program that we have on the website, and then sign up and see the options that she has available. And there's an email address that's connected to the program that she can ask, get direct answers for. Because if she's that talented, she wants to get some other program, she should explore all of our options. And some of the options that she may have are actually on the website itself.
Perfect. Well, that's all the questions I believe we have. So I again want to thank you for your time, Sterling. We appreciate you being here, and our attendees, and I appreciate it as well. The next program will begin. Hold on, I have to pull it up. There we go. Our next session is post-secondary apprenticeship for youth. The paycheck program. It's a pathway to employment, and will begin at 1:30. You're welcome to remain logged on during the break.
Okay. Thank you very much. All right. That's it for me, correct? I'm just checking. Thank you very, very much. Appreciate it.
Thank you very much.
Thank you, Ms. Henry. Thank you, cousin. I appreciate that.
I may be being a little biased, but I loved it.
Thank you. Thank you very, very much. Bye-bye.
Mhm. Hey, Sue.
Hey, Bambi, how are you doing?
I'm good. How are you?
I'm excellent.
Good.
Is Michael on? I can't see who's on. Oh, yes, I can.
I don't see. I
Oh.
searched for his name.
Yeah, he's not.
Michael, if you're on, raise your virtual hand. Oh, wait. I have two people that raised their virtual hand, but I don't know if they're Michael.
Curry, Michael Curry. I don't see him.
I see Claudia has her virtual hand raised, but I don't think that's Michael.
Yeah, no, he always comes up just as Michael.
Okay.
Let me see if he's on. I'm gonna text him. Maybe he's just grabbing coffee or something. Let's see. CH.
Claudia, I see your hand is raised. If you have a question or comment, you could put it in the Q&A.
I just texted him.
I can see you. I could hear you.
I'm good.
Are you gonna share a screen, Sue?
He is actually.
Okay. Okay. I'm gonna go ahead and turn off my camera and mic, and we'll wait till he gets on to test everything.
Okay, yep. Yeah, he didn't answer my text, but I talked to him by email this morning. Try to tell him to remember to provide a personal description when he introduced himself.
Okay, I just promoted Michael to panelist.
Okay, good.
Hey, Michael.
Hello.
How are you?
I'm
Good.
good. How are you?
Good. If you want to practice sharing your screen, just to make sure it works for you. And then once you do that and it works, we'll ask you to take it down until after we do introductions.
Does that work?
So I see it's your whole screen. It's not just the PowerPoint. So you might have to click
I
on.
haven't. Yeah, I just need to put it in.
Yeah, view.
This quick.
Maybe the view. Yeah, the slideshow from the beginning. Yeah.
Is that good if I
Okay.
just play the slideshow?
Yep, that's perfect.
Okay.
All right, so if you can take it down, seems like everything's working, and we'll get back on in about 3 minutes for the introductions.
Okay.
All right. Okay, you guys, we'll go ahead and get started. Good afternoon. My name is Bambi Palazola. I'm the director of the Governor's Office of Disability Affairs. I am a white female in my 40s with long dark hair, seated in front of a stone fireplace that is completely unnecessary in South Louisiana. But this is where I am at. And enjoying the conference so far, and really excited about introducing our next panel and presentation. The next session will be the post-secondary apprenticeship for youth paycheck, a pathway to employment. The presenters will be my dear friend Sue Killam and her colleague Michael Curry with the LSU Human Development Center. You can read the description for this session and their bios on pages 25 and 26 of the conference booklet, which is linked in the chat. So Sue and Michael, I'll turn it over to you guys.
Thank you, Bambi.
Okay. Do you want to start, Monsieur?
Yeah, just, you need to start the slideshow though.
Okay.
Okay, well, welcome everybody and thank you for coming to our session. We're very excited to talk about the Paycheck program. The full name is Post-Secondary Apprenticeship for Youth. Just a little disclaimer up front, we are not a comprehensive transition program, but we are a transition program that's created out of the partnerships between Louisiana Rehab Services, the community college, school systems, and being a CRP. So Michael and I are gonna talk to you about that today. I am gonna describe who I am, at least for those who would like to know. I'm a middle-aged white female with shoulder-length blonde hair. I'm wearing a red blouse and I'm sitting in my office. So behind me is a kind of blurred window that's part of my office. Michael, do you want to give your description of yourself?
Yes, I'm Michael Curry. I'm a young 27-year-old white male with maybe like a swoopy business haircut. I've got brown eyes. My background is just a wall, so you're not missing much.
Thank you.
Yeah.
So Michael and I are going to share the presentation today, and then we'll both be happy to answer questions as you go or towards the end. We have allowed plenty of time that we can, talk about anything that you guys would like to know more about Paycheck. So these are the objectives that we're going to go over today, and I'm going to review them quickly. We're basically going to just give you an opportunity to understand this career pathway transition model that is set up to be very, best practice. We're going to identify some of the key collaborators that are necessary in order to set up a Paycheck program, and we talk a little bit about using them and how to include them in if you're going to do a Paycheck pathway. And then we're going to, at the end, talk a little bit about how you might like to develop your own regional interagency community of practice to do a career transition pathway model like Paycheck. We're beginning to do some of that with the school districts. We've got a couple of school districts that are going to be contracting with us to actually come and help them set up a Paycheck in their local community using their regional and local resources. And so that's kind of a new thing. Previously, we had thought that we might actually hire staff in different parts of the state and then do Paycheck out of LSU Health Human Development Center. But it just seemed to make more sense to try to do it through a local community of practice using the local governing entities and those agencies that were in that community and those people. So our local program, which we call Paycheck New Orleans, it's really Greater New Orleans. We serve Plaquemine, St. Bernard. So we've had people from all over Jefferson, Orleans Parish. We have had a couple of people actually previously from St. Tammany or the Florida parishes area. But, the bulk of the 25 or so students that we have in our program are from the metropolitan area. We obviously, we're the Human Development Center and we're located at LSU Health in New Orleans. We collaborate with the Louisiana Rehabilitation Services, and they fund the services that we provide that are the pre-employment transition services for those youth that are between 18 and 22. We also work with the public school systems. We have a contract right now with Jefferson Parish Schools. And we also have a contract with Kenner Discovery Schools, and we're working on contracts with the Metropolitan and Jefferson Parish and Florida Parishes Human Services District. So we've been able to add in some of the IDD agencies, regional agencies, which has really been, they've been really receptive to this, and we're happy to say that they're going to be a funding partner for our program this year. And then, of course, one of the key collaborators are employers, because the Paycheck pathway is a career pathway, and we rely very, very heavily on employers of any size, large employers and small employers, to be able to have our students access all those sites and gain real work experiences and get real pay.
Okay, this is where I come in. I'm going to start to describe kind of what the paycheck model is, and then kind of in more detail, and then Ms. Sue is going to come in and talk about how we're going to help train in your area for this model. So we kind of have a pathway. It's a 3-semester program for students age 18 to 22. We start by enrolling them into a community college in the area. So in New Orleans, it's Delgado at City Park. We start by maybe they've taken 2 classes, and in that time, and that step 2 will be training them on work readiness skills. So that's job exploration. It's finding maybe things that they're interested in, how to set goals, financial literacy skills, resume building, transportation skills, basically setting the foundation for social literacy skills too. Basically finding the foundation for how they're going to go about getting their job, how they're going to be successful in their job. So we start there, and then we move to, once they do identify kind of something that they're interested in, or somewhere that they kind of want to check out more about, we'll do site visits and general shadowing, which is going to be just going to a place in the community with a few of our students, and we're basically conducting informational interviews. We're exploring what things what it takes to get a job like that, what it actually involves, what a job actually, because we don't see a lot of the things that happen behind the scenes. So we want to explore exactly what it takes, how long the shifts are, what kind of communication you have with other people. And when somebody does identify something that interests them or piques their interest, they will hopefully set up a job shadowing opportunity for them to shadow the person, so you can get a little bit more of an understanding of what the job takes. Then in number 4, right there on 4, you'll see that's whenever students actually get into positions, and we call them internships or apprenticeships, which will be set up by the job coach, and the person is basically hired on as an employee, getting paid whatever wage somebody in that position is getting paid, and that money is being reimbursed by Louisiana Rehabilitation Services while we train them on site. So whatever job they get for 240 hours of work, the business can get reimbursed. And in that time, where somebody like myself or Brenna, the other transition specialist at Paycheck, would, or whoever else was providing the service, would train the person to be fully independent. The goal is for them to be fully independent by the end of the 10 weeks. And hopefully usually it does, but hopefully that leads to a long-term placement. That's step 5. That's what we're looking to get to. We're looking to get them in a place where they're fully independent for up to 90 days of successful employment. They stay there with little involvement from us. And so that's the whole goal of the program. We're going to go a little bit more into the stops. So important classes that we like all of our students to take is something like college and career success skills, so they understand how to, in those classes, it'll kind of support what we do in work readiness training. They'll create resumes, or they'll discuss how to interact with teachers or bosses or colleagues, how to collaborate as a team. And then, so it's a very good complement to how we start off in that. So that first semester, we like to students to take the college career success skills. And then also on top of that, customer service. A lot of the people we work with will end up having to use customer service at some point. So that's another one that we like to stress all of our students to take. And then on top of those 2 courses, they can take whatever courses they see fit, whether they want to go into a career with animals as a vet tech assistant, or they want to be an artist, or they want to work on cars, they want to work with computers. There's a lot of people that want to go into IT, or at least think they do at first, and then but taking that class exposes them to it, and it helps them learn whether or not they want to put in the work to be there, or whether or not they would really rather do something else. So it's the post-secondary courses, being on campus. There's both of those things kind of add to the training and the actual getting the job, because they get exposure to peers whenever they're on campus. They get exposure to new career paths that they could take, and how much it really takes to be a professional in a certain area, and whether or not they want to do that. I think everybody going into college kind of has some question on what they want to do. And I know my dad always told me he wanted to be a vet growing up, and the first veterinary class he took in college and how competitive it was, he was like, well, maybe I don't want to be a vet that much. So having that exposure really helps. One of the things that we offer kind of on top of the services that LRS pays us to provide is the STAR plan, which is a person-centered plan for each one of our students. The overall goal of it is to set long-term goals in those 5 different categories. So we have career, school, independent living skills, community, and self-determination. Community is going to be more of how are they going to be engaged with the community? What is their social life going to be like? Basically, how do they want to be out of their house? What kind of community do they want to have? So we'll set in the center, you'll see a few goals. We'll set those 5 major long-term goals. And on each of the arrows, the next to the arrows, we'll set short-term goals to how we're going to go about achieving those long-term goals. And then we'll also, the actual arrows pointing to the star are going to be action steps for how we're going to go about achieving those short-term goals to eventually achieve those long-term goals. So a lot of it is just an opportunity for us to meet with the families or anybody who wants to attend that's close with the student and learn everything we can about the student. It's guided by the student's making all of the choices of what kind of goals they want, but it allows us to understand the dynamic of the family and the kids. It allows us to really see what kind of goals are set by the kids and what kind of expectations are set by the parents, and helps us kind of round out the pathway of how do we want to align this program with the goals of the student. So it helps us all get on kind of on the same page. And a lot of times the STAR plans leads to what types of skills and trainings that we're going to work with them on. If, all this work-life and skills training is one-on-one. So, a student might say that he wants this job. Let's say he wants to work at a movie theater. Okay, well, it's not just watching movies. So what kind of skills are you going to need to be able to work at a movie theater? And I'll be able to speak with the family at the STAR plan meeting and the student and be like, okay, well, can the person sweep? Can he use the vacuum? Does he have some sort of customer service skills? We'll always work on that, but we'll see what skills that we need to work on in order for them to get the position that they want to get. Are they going to have, transportation to and from work? Is it something where we have to teach them how to Uber, teach them how to use the bus, or are we going to have to set up with the family some sort of, parish funded transportation? And on top of that very specific skill set training, we're also training on self-advocacy and self-determination. That's, I find, a very important part in a persons with disabilities training, because they oftentimes are having decisions made for them. They don't necessarily know how to resolve conflicts. So learning how to do this, how to do those skills in a community setting and empowering the student is a big part of this training, and kind of why we like to give it a few months before we send them right into the job, because having that, instilling that intrinsic motivation into the kids to, or I say kids, but they're young adults, to want to do things for themselves, want to advocate for themselves, understand what rights they have. It takes a little bit. So in the work life and skills training, that's something that we emphasize a lot as well. And yeah, we get into career exploration, which is, like I said earlier, the employer site visits. We're just learning a lot more about the environment of what's the conditions that we're working in. What are the tasks that each of the employees has to do? What kind of skills or certifications do you need in order to get that? And then on top of it, once we do identify an area, we'll try to set up a job shadowing experience like this. This is Cameron. He was one of my students. I'm going to talk a little bit more about him later, but he went to Peace, Love, and Little Donuts, and he was able to shadow somebody. They let him actually like make 6 donuts of his own, and he got to take them home, which he liked the donuts, but he learned that he didn't want to work in like a restaurant, or didn't want to work in like more of a high pressure situation where he felt like, somebody's telling him to make 6 donuts really quick and he has to do it, and he has to do it right. So it doesn't always have he was interested at first, but it doesn't always have the effect that, oh, I want to do this job. Sometimes it tells us exactly what we don't want to do. And that was just as helpful in that situation. And yeah, and then we get into the paid internships, which is, like I said, it's, I always say 10 to 12 weeks, just depending on the student. A lot of times that 240 hours mark doesn't get hit until a little bit later. And I would like my interns to have as much experience as possible. So yeah, when we're doing those internships, all the funds that the employer pays to our students is reimbursed to the employer. And in that time, I am job coaching, or Brenna is job coaching the students and making sure that they know exactly what they need to do. A lot of that includes, making a task list, talking with employers, understanding what the capabilities of the student are, and empowering that student to speak up for what he likes to do and what he doesn't like to do, or what he feels his strengths and weaknesses are, and kind of being able to advocate for himself and talk to the employer. That's and trying to find those natural supports within the job so that the person can continue working there. We always want to try to make them as independent as possible, and not just, we're never doing the job for them. We're never talking to the employers, only us, and never, as far as scheduling goes, I try to make sure that my students or the parents, sometimes the parents are involved, are talking to the employer a little bit more, and I'm more of a support rather than I'm scheduling out everything. And yeah, after they do the internships, hopefully they can find a position that they really loved. If they didn't like any of the internship spots that they were at, then we hopefully can find them somewhere else. And the program ends after 90 days of successful employment, just meaning they're completely independent, no problems have occurred, the employer's happy. And yeah, what time is it? 1:50. I think we have time to show this. This is a Paycheck of North Shore YouTube video. This is just a few of my students that, we had that in the pilot program with North Shore. So let me see if I can pull this up. I'll have to do a new share.
As an entrepreneur, as a creator, I'm 24/7 on the go all the time. Shopify makes it very easy to be on the go and connected with my store. My name is Chef Jamoke.
Can y'all see this?
Starting in 2016, the Paycheck program has included Orleans and Jefferson Parish, but now the program has grown to the North Shore. The Human Development Center has partnered with St. Paul's High School to pilot this new Paycheck program. So let's meet the new interns.
Hi, my name is Luke and I'm one of the new students. I'm Alex Courtney.
So what kind of job do you want to have?
Vet assistant. That sounds like a shit job. I either want to be the director or be the film editor. Why do you want to work?
Make money. Pay off.
It's just something that I can look forward to every day. And I like working with animals. So I can pay bills and give me pride.
Paycheck prepares these guys for life after high school by teaching independent living skills, like learning to take an Uber, one-on-one work readiness training, and instruction on how to write a resume or find a job. Paycheck offers 2 paid internships and hopefully placement into a long-term career path. So what have our Paycheck guys on the North Shore achieved so far? Luke has learned to use Uber completely on his own. He has developed interview skills and attended his first interview ever, and he has started his first job as a prep cook. Dustin has learned all about self-determination and self-advocacy. He is in the process of being hired at a physical therapy clinic, and he has developed many independent living skills, such as cooking meals. Alex has gained many work-related skills in his time with Paycheck, such as time management. Alex got his first job as a grocery clerk, and he has even gained financial skills, such as saving money and opening a bank account. Visit our website to learn more.
Okay. So yeah, that actually, Luke was the one that said he wanted to be a vet assistant. He's actually working at a veterinary clinic right now, as I would say, kind of an office associate. He's kind of an assistant to a vet assistant, but he hadn't gotten any certifications or anything. And he actually went in to bring my dog in there the other day, and he was doing great. He's just like clocks in, clocks out, chats like he's the most important one in there, but it's awesome. He loves it. He really does. This is one person that wasn't in my the video, but he was in the program with the rest of those guys. This is Cameron. He we didn't take post-secondary courses on the North Shore that first semester. At least the guys at St. Paul's didn't. So we actually went through a CPR certification course with him because he wanted to work in as a camp counselor at Franco's Athletic Club. So he completed his CPR certification. He learned how to use Uber because there's not really much buses in the North Shore that are very convenient. He took leaps and bounds as far as like self-advocacy and self-determination. He really used to hold everything in and get very frustrated. And through working with him after, also with the school, but working with him in that year, you saw the change of how much he was able to just go to somebody when he had a problem and let them know, and kind of knowing what his rights were and knowing that if he wasn't comfortable with something, he could find a way to figure out what's going to work best for everyone. Yeah, we went to many different places. He was the one that went to Peace, Love, and Little Donuts. That's pictured right there. He wanted to work at ice cream shops. We went to many of those, health clubs, restaurants. We visited many places with him. And eventually he got an internship at Franco's Athletic Club as a camp counselor. And yeah, he's still looking for his last placement, but he is a whole different person than whenever he first came in. He is so much more independent and so much more able to advocate for himself, and he knows what he needs to do moving forward. And it was great to see. But yeah, that's my little spiel on Paycheck. That's what we do, and that is what we want to train people to do in the future. And I'll let Miss Sue take over from here.
So yeah, we're gonna be on for a while to be able to answer any questions about like the actual program pieces and kind of more about what we do. I also wanted to talk about how we're trying to expand Paycheck now across the state. And so we are working with Ali Kowitz and the new educational committee here at Innovations in Education at the Human Development Center. And we're proposing some sample partnerships to the school districts, between the school district and the Human Development Center, the tech program, which I'm the director of that division. We've worked together to establish these kind of packages that we can offer to a school who has primarily students who would be Louisiana alternate assessment and would be looking at coming into a program like Paycheck when they're between 18 and 22, and who want to receive those 12 months of services that include, like Michael said on the pathway, some coursework at a community college, the opportunity to be on a community college campus, and all of the pre-ed services like the pre-ed units, the job shadowing, the worksite visits, the paid internships, and then placement into employment in a job that now they hopefully have been informed a lot more about what might be available and what they might be good at, and then we can help them get a job. So we have some comprehensive packages that we're going to provide supports to the school to identify some of those folks, to the families, to the regional and local DD agencies and LRS offices, to some of those staff so they understand the program and who would best fit in it. Also to look at employers that are in that community to determine what would be good large employer sites and where might be some really good pilot employer sites of smaller size. So what we're going to be able to do is we're going to be able to kind of customize the package based on the school district, how many students they have, what they want to do. And we're doing that now with a couple of school districts. And so we'll be looking to start with them. So ideally, we would be myself and Michael and Brenna, and then possibly some people that we may bring on that live in that area. We would work together to develop that community of practice between all those agencies, and to foster the collaboration that's necessary to move 10 to 12 students through a 12-month pathway that basically leads to enhanced careers and enhanced employment for each of those students. And it would also involve a local community rehab program. So our role, the Human Development Center's role, would be that we would be mentoring the community rehab program and the teaching staff and the paraprofessionals who would be involved with being on the site with the student, teaching work skills, and assisting them with some of those pre-ed units. So this is a whole lot of words on a slide. Essentially, what we're going to be doing and what we have done with a couple of school districts that we're looking at right now, we'll work with the school. Ultimately, we would be working with the school district, and we'd be doing some of these services through the Department of Education vendor guide. So we would be planning uniquely with each school district that wanted to do this. The only thing that we would maintain is if you're going to do paycheck, we need you to do each of the components of paycheck, but the school can decide whether the student's going to take one class at community college each semester or 2 classes. I mean, we'll work with them to suggest what we think is best practice and what some of the coursework should be, and the extent to which we might need other staff from the school and or from the community rehab program. But we also will look at scheduling and outlining some of the community of practice meetings and trainings that will happen. So we want the school, the community rehab program, the Louisiana Rehab Services staff and representatives, as well as the IDD community and the local governing entities as human service districts, to be able to have some staff, if not support coordinators, also come in to be able to help with some of the planning that is going to need to at least occur as we get closer to the end of our career pathway, and the individual will need possibly some more job coaching while they're on a job site now, maybe at a full-time job, but they also might need some PCA supports or some other Medicaid services that they likely would be eligible for if they have a statement of approval from one of the human service districts. So we're really kind of expanding what we do. In terms of the funding, we previously were just using Louisiana Rehab Services and some school money, and now we're looking at and doing the services ourselves. And now we're looking at training local communities, building the capacity of a geographic area to be able to do this model themselves, and be able to provide some mentoring and longer term support to them to keep the model going and to make sure it stays. The fidelity model is in place, that everyone's doing the right things at the right times, and that they're clear on what they need to do. So we're what we end up doing is breaking down all of what I just said, all of the supports that we would provide across, I think this is only like 11 months or something, because we know this summer, especially in June, we'll give everybody a month off, especially since we're working with schools. But most of the administration is there pretty much, if not 12 months, at least 11. And so we would use some of that time in the summer to do some planning for the new cohort of students that would be coming in a particular school district. And so we would divide the time that we would be providing some type of mentoring or support across these 4 rows. The first being that the meetings that we would facilitate, which would be initial meetings and ongoing. Obviously, to set up a model in a new community, we'll have to go in and meet with local VR, the IDD agencies, talk with the Families Helping Families if they have an active Families Helping Family in that area, some employers, some of the business community, and begin to assemble some of the resources, and then certainly the school and the personnel, both administrative and then down to direct service or boots on the ground. We would offer some training events, and we'd recognize that we don't have a lot of time to provide the training. We'd be looking for staff that are already qualified or certified or have had at least experience, and then we would be providing more like overview of working with those collaborating agencies, as well as working best practice models for working with individuals with disabilities on career pathway models, and how to best support them, and also how to configure some of the coursework they take and some of the apprenticeship and internships they do to enhance their resume, to build their resume and their visual resumes so that they're more attractive to employers, but also so that the individual and their family begin to understand what types of jobs are available for their son or daughter or themselves as they begin to experience like some of the jobs that are out there. One of our biggest things, and I think Michael might have alluded to it, is a lot of people come to us at an age where they're not really sure what they want to do. And I think we were all that age, and we're equally as unprepared. We might have had some grand idea, or we might have just had, maybe we just wanted to scoop ice cream. But and that's fine, but we want to be able to make sure people understand the difference between scooping ice cream and then going to an ice cream shop to get an ice cream and to eat it. Sometimes it's not as fun working at an ice cream shop as it is going to an ice cream shop to get that wonderful ice cream cone. So part of the community jobs exploration really helps us help the individual decide the environments they like and what they might be really good at. And then even within the environments like pet care, you could work at a Petco or a PetSmart, you could work at a vet's office, or you could work at an SPCA, or you could work, and those would all be very, very different jobs, and they'd all would pay differently. And so we want people to kind of to be able to experience that. I don't mean that they would experience every job in every field that way, but when they started talking about, I think I like working with animals, then we would try to narrow that down in terms of, if you work at an SPCA, it's most likely that you would probably be spending a lot of time cleaning cages and doing some cleanup work and maybe walking animals and things, but that would look different than being at maybe a vet's office and helping to do some probably kennel cleaning, but also walking the dogs, greeting customers, bringing out the animals that have been boarding, that are going back out to the customers and things like that. So we're just trying to show people all the possibilities. And then the coaching hours would be our time, Michael and Brenna and my time in that community, being able to provide some supports to the staff. Essentially, we think that a great deal of support would be for a lot of the site development with the employers and trying to identify jobs, especially for programs that may have not as much experience setting up paid internships, who maybe are not sure of the process and some of the rules with it. And then the community of practice is really where we're trying to set up these quarterly meetings where those agencies that tend to work somewhat in silos, although they are pretty good partners, I think, and they work fairly well together, but giving them a scheduled opportunity, a scheduled facilitated opportunity to actually look at what does transition look like for individuals in their local community. And oftentimes it's really easy for them to be able to identify the numbers of people and where some of the real points of pain are, like where they're having issues and what needs to happen. And if you get the right people in the room, oftentimes you can solve many problems, or at least bring up several suggestions and begin to facilitate resolution of some of the what seems to be barriers for doing this kind of approach. And again, this is just another piece of the justification. We're just trying to show you that we have figured out a way to kind of be able to go into the regions and provide those trainings and coaching and initial meetings. We'll break it all out. This would be customized to whatever district we're at. Some people may want only half of this. At some point, there would be a low option and then a high option. It would really be up to the school and the collaborating partners to determine what they felt like would be the required amount of on-site hours and what those total hours that they were willing to absorb. Now the funding for this would come, as I said, through Louisiana Department of Education, through the vendor guide, where they will let schools have grants or parcel out the money to be able to do better performance in this example, in transition for youth between 18 and 22. And so this method of providing those supports would help the school with that, and of course would all have to be contracted through HDC. Michael, I think this is you.
Yes, it is. I was unmuting. Yeah, so how we get involved with Paycheck, participants, people aged 18 to 22. More like, if you're looking at it, I would say people aged 17 to 21 start looking at it, because we can't necessarily, I know I saw a question in the chat about that. We can't necessarily work with somebody the full year if they're 22 and a half, because their services will end by the time they're 23. So yeah, by the time you're 17, I would look into getting involved with Paycheck as a participant. School district partners, of course, we're saying, we're always willing to help train a school, at least get in with the new school in an area, and employers always looking for new employers to new opportunities for our students to have, internship opportunities, placement opportunities, job shadowing opportunities, just anything that an employer wants to help with or wants to host a intern of ours. That's probably our favorite way for people to get involved. So this is a link to a pre-application for new students. There's openings in Greater New Orleans, St. Bernard, North Shore. This is school partnerships. This is the Paycheck webpage if you want to learn anything about that as a school system. And then this is info, sign up for employer opportunities if any employers are looking to host a worksite visit, job shadowing event, paid internships, or just looking for a trained employee to hire, any of those things. And yeah, that's it. We'll answer a few of these questions in the live chat. I'll start with, I think, okay, what's the most important for student success, developing skills, or developing a philosophy/attitude to foster success? The first thing that comes to mind for me, and Ms. Sue can also speak on this, and I was kind of hinting at it earlier, I think a lot of student success comes from intrinsic motivation. Okay. Comes from intrinsic motivation. I think if I can figure out a way to show a student why it's important for them to learn the things that they need to learn, to make the choices that they need to make. Why is it important to have a job? Why is it important to make money? What are the goals that you have that won't happen unless you decide you want your life to go this certain way? I think a lot less of the things, like the hard skills that we teach, are as important as that. If you can figure out a way to make the student want to learn on their own and want to continue to advance for themselves personally, in their career, with their family and relationships, I think that's the most important to foster success. What's that? Let's answer another one. Are there any plans to expand the Paycheck program to other areas of the state? I guess we kind of went over that. We definitely, it's maybe not our employees, but definitely the Paycheck model we want to expand to as many areas in the state as we possibly can. Do you think you'll be doing a Paycheck program at Nunez Community College anytime soon? I don't think so. I think, is that in, where's Nunez, Ms. Sue?
Plaquemine. It's in Plaquemine Parish. We would love to do something at Nunez. We'd like to do something in any region where there is a community college that we can access. We have had some of the people who live in Plaquemine have come up to New Orleans for the program. We've never gotten enough people. We need the school districts to allocate the people, the students. So ideally, the students in the Paycheck program would be on an IEP with the school, and they would be like 18 or 19 or 20, and they would stay with us for a year, and they would do the 3 semesters, and they would do all the job sampling and the internships. And so we would be happy to use Nunez Community College. We've reached out to them, they're ready. We just need the students. So we need the school to want to do that with us.
Is there someone, if someone is in the program but will turn 23 before they finish. Do they get to stay and finish, or do they need to exit the program? Once they turn 23, that's whenever we move to only the placement services. So they can't receive any other of the work readiness training or work-based learning experiences like the employer site visits, the job shadowing, or the internship opportunities. Paycheck can still work with the person, but only for placement. So no job coaching services. It's just going to be helping find them a job.
Yeah, Nunez is in St. Bernard. I apologize. I said Plaquemine. It's way down in the parish, and we have had a lot of interaction with the school district there and a lot of parents. But the parents have had to bring their kids up to New Orleans because the school actually supported a couple of people and paid for them to come up to New Orleans. They didn't have enough for us to do the program at Nunez.
How many persons differently abled request job coaching and mentoring? How may a person differently abled request job coaching and mentoring? They could go to LRS. That's probably their first step. You go to wherever your local LRS, I don't know why I can't think of the word, rehab center or whatever it is. You can contact LRS. You can see all the offices that they have on LRS's website, Louisiana Rehabilitation Services, and they will connect you with a vendor in the area for job coaching or mentoring. Is the Paycheck program in Jefferson Parish, other parishes? Yes, it's in Jefferson Parish, and it is in what is it? What's the other parishes? I guess St. Tammany Parish and
Orleans.
Is it St. Mark? Orleans. Okay. Are there any programs of training students in agriculture, growing, harvesting, selling produce? Not that I know of. Do you know, Ms. Sue?
Well, we could be doing that through the community college if they had that available, and I'm sure that some of the community colleges, have some of that. We try to go with the workforce programs they have. So if that's there, we would look at all of that and whatever that area offers in terms of jobs.
I think that's all the questions.
Thank you guys so much for your presentation. We really appreciate it. It was very informative. Really appreciate all of your work and just, setting up the model for best practices and of course the impact, just the invaluable impact it has on the individuals that you're helping, but also systemically. So thank you all.
You're welcome.
Thank you. I appreciate you having us on.
The last session of our conference will be making heads and tails of the Fair Housing Act and emotional support animals. And we'll begin at 3 p.m. You are all welcome to remain logged in for our last session. Thank you guys for hanging in.
Hey, Molly. Hi.
Hi, Molly.
Hi.
We can hear you.
I'm not going to turn my video on to conserve bandwidth.
Got you. Do you have a PowerPoint or anything?
I do.
KJ, can you let her try it out?
I've already took everything down for her to.
Oh, of course you're on it. Oh yeah, it looks good.
I've already taken. Does that look good?
It looks great.
Not as good as your next slide.
I got some text last night about the picture of me and Charles. I guess they saw it in the panel from yesterday.
Yes, super cute.
There's several pictures of Charles, so he won't disappoint.
Good. So you can just keep yours up, Molly, because the introduction will just have the interpreter. The interpreter will be the only one on camera, I think.
Perfect.
Unless KJ, you think we should put up so people know what time we're gonna get started?
Yes, ma'am, I can put it back up.
Okay, so change of plans, Molly. KJ is gonna put up her cute graphic. So KJ, interesting thing is it's showing that you and Molly are both sharing your screen, but Molly's screen is the one that's showing.
I can stop sharing real quick.
I didn't even realize that. Let me see.
I just looked.
Oh,
Molly is obviously overpowering you.
okay. Let's see. Okay, what about now?
Now yours is up.
Sorry. I have it up on YouTube and like as an attendee, but I'm so deep into this newsletter.
I forgot to send you my inputs.
Girl.
What have you been doing, Molly?
Sleeping?
Good reason to. We'll be starting in about 3 minutes.
3 minutes.
Good afternoon. The last session of our conference will be making heads and tails of the Fair Housing Act and emotional support animals. The presenter will be Molly Tennant, who is the FEMA Disability Integration Specialist assigned to Louisiana. You can read the description for this session and her bio on the last page of the conference booklet, which is linked in the chat. Molly, I'll turn it over to you.
Thank you, Alicia. Just going to share my screen real quick. All right. So I'm not going to share my video just to make sure there's enough bandwidth, just to conserve the bandwidth. So just again, the presentation is called Making Heads and Tails of Emotional Support Animals and the Fair Housing Act. Again, my name is Molly Tennant. There is a picture of me on the screen. I am a Native American Hispanic woman with shoulder-length black hair with black glasses. And in the picture, I am holding my emotional support animal, who is a blonde Chihuahua Terrier type dog. I don't have a good description of him. He's a little bit of everything rolled into one. I am the Disability Integration Specialist for FEMA assigned to Louisiana, certified ADA coordinator. I also have my executive certificate in home modification from the University of Southern California. I do identify as disabled, and again, my emotional support animal's name is Charles. All right, so why is this topic important? A recent study found that adults with disabilities report experiencing more mental distress than those without disabilities. We go through a lot more dealing with disability, from dealing with multiple doctors' offices, going through flare-ups, being stuck, feeling trapped at home as a result of symptoms, or maybe just anxiety that somebody will notice or look at your disability for a variety of different reasons. And emotional support animal is a great way to cope in a healthy way. Many rental properties prohibit pets or make it cost inhibitive to have a pet. And during disaster recovery, pets are at times surrendered or prevent people with disabilities from obtaining long-term housing unnecessarily. And there's already a shortage of housing. So having another obstacle like a pet that helps you cope with life shouldn't prevent you from finding housing. All right, so just a few definitions, since there are different types of animals. Service animal is a dog or miniature horse that performs a task directly related to an individual's disability. Some of those examples are directing blind persons or alerting deaf persons, guiding a wheelchair, alerting to an onset of a seizure, reminding a person to take medication or to calm a PTSD or anxiety attack. Under Title III of the ADA, which addresses public accommodations, there are two questions that a business owner are legally allowed to ask of a person with a service animal. They can ask whether the animal is a service animal and whether it performs a task directly related to your disability. They may not require documentation, such as proof that the service animal is certified, trained, or licensed as a service animal. So emotional support animals, there is no precise definition under ADA. It is any animal of any kind whose function is to provide support to its owner. It is not limited to dogs or miniature horses. On the right of my screen, there is a picture of an older white gentleman holding an alligator that says emotional support. So this is Wally. He is an emotional support alligator, and he resides with his owner in Pennsylvania. They do go on tour together. Wally is a rescue, very well behaved, does not bite. And this man even reports that he sleeps with Wally for comfort. These animals are not required to have any specific training, and they are not required to perform a task specifically related to the owner's disability. And then there are therapy dogs, which are trained to provide affection, comfort, and love to individuals, and they volunteer in settings such as hospitals, nursing homes, disaster shelters, schools, etc. All right, so service support versus emotional support. Emotional support and animals generally do not qualify as service animals. Excuse me for 1 second. Okay, well, that's not going to stop. They do not qualify as service animals under ADA because they are not trained to perform a specific task related to the owner's disability. And places of public accommodation are not required to permit emotional support dogs on premises unless required by state law, which I'm so sorry for that. Louisiana law does not recognize ESAs for public access. All right, service animals and emotional support animals are not pets. So it's important to remember that the animals are needed to assist, support, or provide services for persons with disabilities, and they are not considered pets and therefore are not subject to certain conditions of pet ownership. That does not mean that Charles does not have a fun-filled doggy life. He has tons of toys, he has clothes, much to his dismay. He still plays in the yard. He still plays with other dogs. He still does all of the doggy things, but he has a purpose, and that is to provide support for me while I am doing my treatments and when I am having flare-ups and stuck at home, so that I don't feel isolated by my disability. All right, so what qualifies a pet as an ESA? ESAs can be used to assist with a variety of different conditions and disabilities. It's very widespread. Some of the primary ones are depression, obsessive compulsive disorder, personality disorders, bipolar disorder, phobias, anxiety, panic attacks, PTSD, physical disabilities, intellectual developmental disabilities. Again, it's a very broad spectrum, and there's not a limit on
Molly, we can't hear you. Just give us a moment. Molly, you there?
Yes.
We couldn't hear you.
Yes. Sorry. Can you hear me now?
Yes, we can.
Okay. So what is a reasonable accommodation? It is a change to a rule or a policy that is necessary to provide an equal opportunity to use and enjoy a dwelling. So this covers tenants, homeowners, and prospective homeowners. It also covers family members and people with disabilities who are associated with the above. And this applies to dwellings or housing providers. So landlords, HOAs, homeless shelters, group homes, nursing homes, dorms, etc. There are a couple of exemptions to be aware of. And the first one is a subject property that has 1 to 4 units and one is owner occupied. And the second exemption is a rental if it's a single family home rented out without the assistance of a realtor. In addition, the owner of the home must not own more than 3 single family homes. So a single individual who owns an income property on the side of having their own home would not qualify as being needed to be held to the Fair Housing Act. All right, so service animals and emotional support animals, as we stated earlier, are not pets. So conditions of tenancy in areas may include a no pet policy, a payment of a pet deposit, pet rent, limitations on the number of animals in the unit, and prohibitions on individual animals based on size, weight, or breed. So like we said, the service animals and ESAs are not pets, so they are not subjected to those above conditions. All right, so once you have a service emotional support animal, how do you request an accommodation? Tenants can request an accommodation orally in writing. I suggest if you request it verbally that you follow it up in writing as well, summing up the conversation along with the date that you had it, just to maintain for your records, and just to retain all of these records just in case. When making the request, you should explain what type of accommodation you are requesting and the relationship between the requested accommodation and the disability. So in this case, the accommodation would be to have an emotional support animal, and how does the accommodation helps the animal, may assist you in enjoyment of daily life, maybe getting you out of the house. You have depression and you tend to want to stay in bed all day. Well, this animal is going to help get you up and going. All right, so what you need is an emotional support animal letter. It is a signed statement from a doctor, psychologist, social worker, or another medical professional. There are 3 components that must be included in the letter. That is a legal diagnosis from the provider issuing the letter. The letter does not need to reveal the diagnosis. It just needs to say that the tenant is being treated by that provider for a legally covered diagnosis. The statement from the provider recommending the ESA for the patient's treatment, and why the provider is recommending an ESA, such as it helps alleviate symptoms or necessary for helping the patient live a full life. All right, so here is one of my ESA letters, and required information on here, as you can see, is it is on my provider's letterhead. It's dated, it has the address, it has the contact information for the provider. I think my provider thought he was being really, really funny when he went into the details of why I need one. I was a little upset when I saw this, but he does detail that I have ulcerative colitis, and went on to explain some of the more unpleasant symptoms that I would rather, a landlord not know about, but it does meet the criteria of stating that I do have a covered, I am so sorry about that, a covered disability. And it says that I have mine, I need a emotional support animal for depression or anxiety due to the physical limitations, and that Charles is my support animal, and that they do not have to charge for the pet. All right. Just one other thing is scam alerts. There are plenty of online websites that have popped up that say that they will give you a letter that says that your dog is certified as an ESA. Some of the scams you should look for is if the cost of the letter is under $100, or it claims that you can skip the mental health screening. If they claim that once you pay, you can get an immediate download. And then if it claims that purchasing the letter will register you for your ESA, there is no actual ESA registry. If the company sells kits to make your ESA look more official, like a vest or an ID card, or it promises you can take your ESA anywhere, or that your ESA will always be able to travel or fly for free. So here on the left, this is an example of that. It says the ESA Registration of America. As you can see, I did go ahead and pay for it just to register Charles, just to see what it looked like. But my dashboard, it has a picture of Charles. It says his name, that is a handler, it gives him an ID number. And it did come with a really stupid looking ID card for him. That I still use it. I still have the ID card, but there is no actual registry. So just be aware, don't get scammed out there. Doctors are more than happy to have the conversation with you about an ESA and get those letters to you. It can even be a primary care doctor. So just be aware of the scams. In conclusion, having an emotional support animal is an absolutely great way to cope with the extra stress that comes with living with a chronic condition or disability, whether it's helping to get you out of the house, whether it helps you feel less isolated, whether watching them play with their toys just brings a smile to your face that you wouldn't otherwise have. It's an amazing coping skill. So again, my name is Molly Tinnen, and I am your FEMA Disability Integration Specialist. Here's my contact information, and open up for questions if anyone has any.
Molly, how long have you had Charles?
I have had Charles for 3 years. I got him during Hurricane Laura.
If you have any questions for Molly, place them in the Q&A, please.
Okay, here's a question. Please explain the state federal law difference. You says Louisiana has no law, correct? What does that mean in a practical sense here in the law? Okay, so the federal law for fair housing is just your basics, but some states have more laws that are more that have less restrictions or allow the service animals in the different place. So so it would just have an expansion of rights for the animal. How do you go about acquiring a service dog? There are lots of nonprofits that have service dogs. You can search them online, make sure that you're looking for a reputable one. And then you can apply, and your medical doctor will give you, will help you through that process as well. And then you just get on a waiting list and you can get a dog. If your ESA service animal passes away, are you assigned another, or do you have to request? If your ESA passes away, you are able to get another one. There are no restrictions on where you get an ESA. So Charles is a rescue. And your letter doesn't have to be specific and say that the pet's name on it. So my letter does say that Charles is my ESA, but your letter does not have to specifically say a name, whereas I believe a service animal through their certification criteria does have a little bit more restrictions on that. So to be approved, your animal does not have to be trained as a support animal. For housing, no. It does not have to be trained at all. Emotional support animal is designed to provide comfort, which is why it's a great option, because you can pick an animal that you mesh with, and it just keeps you company or keeps you happy, and doesn't need to be trained. Charles is very aware of my central line and does know to stay away from it. But other than that, he really isn't trained, and I really don't take him out in public because he's actually not very well behaved. So definitely does not have to be trained. Next one is, I have clinical depression, social anxiety, and borderline personality disorder. What does this qualify me for? Absolutely qualifies you to have an emotional support animal. Especially with social anxiety, I'm sure that's incredibly isolating. And having a dog could help you feel more confident going out, going for walks, or keep you company at home. Borderline personality disorder, again, I had a dog as a child, and my parents got it for the sole point is that I was very shy, I was very quiet, I struggled with just talking to people, and I would just talk to my pet for a long time, and looking back, that would have qualified as an ESA. If Louisiana has no law with respect to housing, do you know if there is a Louisiana public accommodation or access law? I don't know the whole answer to that. But I know that the public accommodation and access laws apply to ADA, which would be your service dogs out in public, but not for an emotional support animal. So Louisiana does fall under Fair Housing Act, which every state does, that does allow
Seems we've lost sound with Molly. KJ, can you take down her PowerPoint while we wait for her to connect sound again? Okay, Molly, can you hear us?
where did that Q&A? There's that Q&A. And so you don't have to get it from an agency. A lot of service animals are from agencies, but there are also ways that you can get a dog and train it yourself. You may have said this, but do you pay out of pocket for Charles's toys, food, and medical care? Yes, I do, because he's not a service animal. I am required to pay for his care, but not having to pay for pet rent, or not having to pay for pet rent or cost of putting a pet application in does save me a lot of money. What is FEMA's policy for ESAs versus pets in shelters? Well, so the service animals are allowed in shelters. I'm not sure that ESAs are right now, because FEMA is not the shelter providers. So in Louisiana, we have the state shelters, and then we have the Red Cross shelters. So starting this hurricane season, actually, Red Cross is co-sheltering shelter residents and pets. So your pet, unless it's a service animal, may not be right there with you, but it will be in the same facility with you, making it really easy to walk across the shelter, visit with your pet, spend time with them. In the state shelter, I believe it is still just service animals. But LDH does do a lot, not LDH, the Department of Agriculture in Louisiana does a great job with their sheltering and veterinarian care and everything. The last one is, I was told that a cat is not considered an ESA. There are absolutely no restrictions on what is considered an ESA. It can be any type of animal. I don't recommend the alligator, though. And that is it for the questions.
Thank you so much, Molly, for this informative session. And also thank you for
putting together 2 of our previous sessions during the conference. Although you weren't able to be with us, we certainly appreciate your leadership in coordinating those sessions. So thank you very much. And to everyone, on behalf of Governor John Bell Edwards and our entire staff, which I'll ask them to put on their camera if I'm kind of putting them on the spot, but our entire staff, Liam Doyle, I see him, KJ Henry, and Leigh Chevalier, and myself. We want to first thank all of the presenters who they all volunteered their time, talent, resources, and knowledge to make this conference phenomenal. And thanks to all the people and organizations who helped promote this conference. And thanks to all of you for attending and engaging in this important work of the disability community. And last, but certainly not least, we want to thank our interpreters who have kept up with all of our presenters and all the challenges. So thank you to Tammy and Nikki and Bianca. This concludes our conference. This is the last GODA conference of this administration. We certainly hope that we have developed a model that future administrations take up and continue. And we wish you all a happy rest of the summer. Thank you.
Thanks to you too, Bambi. We love you and appreciate all and everything you do.